Welcome to our panel about polyamory and COVID and how it's affecting our communities, what to do. We have a great list of speakers here. I'm Parnia. Pronouns are she, her, they, them, anything you choose, as long as I answer. I am your host. I and Chrissy and Kay will be leading this discussion. I'll be doing my best. We'll all be doing our best. And there's a lot of information in here, so let's get it started. Who was our first speaker?
Thank you. It's me.
I'm passing it over to Kay. Kay is a freelance writer, event planner, social media expert, and community organizer. Take it away, Kay.
It's nice to meet you. We'll just stick with that.
And my name is Chrissy, she, her. I do a whole bunch of stuff for the community. And we put this together in a little bit under 48 hours. We saw a big need in the community for this information. There's been a lot of disinformation, and I live smack dab in the middle of New York City. So I felt that it was my moral obligation to bring us all together so that we can have a real conversation, using people who know what they're talking about. If you do follow me on Facebook, you've seen that I've been continually keeping up to date on news and stats. And I think specifically with our community, this is a very timely discussion. And it's timely because they're talking about opening up New York yet when a lot of the country and a lot of the world hasn't even been hit yet. Some places have been horribly hit and some places have not. I think us as a poly community, as people who are separated by a degree or two of separation, as people, we are actually quite a small community. And I think it is our duty and obligation to ensure that we are taking all the necessary precautions. Not so much for this wave of COVID, but for future waves, primarily because it's going to die down with our social distancing. They're going to try to get everything back in order, and then we're going to turn around and everybody's going to have it again, or new people are going to get it. So I felt it was very necessary to bring us all together to have this discussion. We're going to have a really awesome panel today. If you're in the audience, hello, thank you for being here. If you want to ask a question, here's how we're going to do this. The first part of this is going to be people, panelists. We're having a conversation and a presentation of some data and information. Then we're going to have like a 15-minute break or so, and then we're going to take questions from the audience. Kay will be reading those questions aloud. Since there are so many people watching currently, I just want to let you know that we're going to be curating questions. Meaning, Kay is going to be hand selecting questions to be asked. If you want your name to be used, you put your name in there. If you want your location to be said, you put and if you have a person specifically that you want to answer the question, put that data in there as well so we know. So, okay, just to give you an overview of what we're going to be talking about, we have a wide variety of topics. If you've seen the invite, we want to essentially ensure that our community stays safe. That people understand what we're talking about here when we're doing these negotiations, and to give you some science, because our media is severely lacking. Then we're going to go into systemics, and we're going to talk to you about some of the media requests we're getting and how to talk to the media, especially if you've never dealt with them before, and how to not undo all of the advocacy work that we've been doing for the past decade or so, and to ensure that first and foremost, the community stays safe. That's my piece. The bigger strategy is going to be, we're going to get members of the community together. We're going to create a movement of sorts. The movement is basically, we're starting with a message and a pledge to all of the community leaders and organizers, advocating for social distancing and ensuring that people have the right information in their hands when they need it the most. A couple of us are going to be working on media pieces. We'll talk to Amy a little bit, who's going to be working on research. And we're going to buckle down and prepare for the next 18 to 24 months of having to deal with this as a community. That being said, thank you for being here. We appreciate you all. Let's get started.
All right, that was Chrissy Holman. I'm gonna go ahead and skip that bio. We have Aila Moireach coming up first. Correct me if I'm wrong at any point, Chrissy. Epidemiologist, microbiologist with a specialty in infectious disease and outbreak management. Great one to go first. Take it away.
Hi. So like Prania said, I'm Aila Moireach. I'm a microbiologist, epidemiologist, and combat medic. I worked for several years tracking infectious disease outbreaks in conflict zones around the world. So I'm here mainly to talk about the inherent risk in polyamorous dating during a pandemic. Please bear with me because I've got about 5 minutes to speak and there's a lot of info to cram in here. Okay, so let's talk a little bit about containment protocols during outbreaks, what those all mean and why they mean that going on dates 6 feet apart or visiting non-cohabiting partners is an especially bad idea. So first, a pandemic is a type of epidemic, and from a public health perspective, it typically indicates severity. For something to be a pandemic, it typically has a sudden massive rise in cases, typically enough to overwhelm existing infrastructure spread across a large geographical area. More specifically, our current pandemic is a mixed epidemic, meaning it originated from a specific point source and is now being propagated via person-to-person contact.
Aila, I'm so sorry. Can you talk a little bit slower? I can't get a single word you're saying to instruct.
I'm so sorry. Okay, so specifically, our current pandemic is a mixed epidemic, meaning it originated from a specific point source and is now being propagated via person-to-person contact. We're specifically seeing something called droplet transmission, and what that means is that the virus is primarily spread through respiratory droplets that come in contact with your eyes, your mouth, or your nose. This can happen both by close contact and by touching something called fomites, which are objects likely to carry and spread infection. Examples of fomites in COVID-19 are doorknobs, light switches, shopping carts, clothing, steering wheels, mailboxes, anything that you can touch. There's some cases in which SARS-CoV-2, which is the name of the virus that causes COVID-19, is spread through airborne transmissions, but those are typically not seen outside of specific healthcare situations. So containment protocols. Most of us now live in states with shelter-in-place orders. Most of us are feeling pretty cooped up, anxious, stir-crazy, and questioning why that's important. So since COVID-19 is primarily spread through person-to-person contact, by limiting person-to-person contact, we should, in theory, limit the spread, flatten the curve, and crush this thing into smithereens, right? What does that actually mean? So, I have visuals. Really messy visuals. Right here, we have a whole pile of Hershey Kisses. I don't know if you can see them. But each pile of Hershey Kisses represents a specific household. Okay? So it means you and everyone who lives with you in your home. So you've got several households here and they're all separated. Now, someone in this household infected doesn't know it. Maybe they picked it up at a grocery store. Maybe they touched a railing on an outside walk and rubbed their eyes. Maybe they went on a date thinking 6 feet would somehow protect them. They decide to hop in this little car, borrowed from my child, and wander off to visit their partner in, say, this household. They've now spread the virus to this new household. Someone in the new household decides they've been really good at social distancing. The only person they've seen is their partner, right? And the partner's good at social distancing. So is it really that big of a deal if they wander over to, I don't know, visit their mom? Now, mom's household has it. Maybe mom is older and has a home health aide. That home health aide now is exposed and spreads it to all of these households. But what if you self-quarantine, see no one, and not leave your house for 2 weeks? Can you then show up at a makeout party, enjoy some group sex, or see your grandma? That's safe, right? Nope. The incubation period for COVID-19 varies significantly. 2 weeks is about the top of the average range, but viruses don't use calendars. Maybe you have 2 people that have completely self-isolated, alone with no one in their apartments. They should be pretty low risk, right? Nope. Say one of them lives in a multi-apartment building. To enter, you need to hit a buzzer, touch an outside door, touch an inside door, stand in an elevator, touch elevator buttons, literally all of which are potential common fomites. Say one of you goes to the grocery store after having touched all of these potential fomites. But I washed my hands. Yeah. And washing your hands, staying 6 feet apart, those are all helpful in cutting down on risk, but they don't eliminate it. Unless you have a self-contained BSL-4 suit and you're recreating Bubble Boy, you're going to be at risk of catching and spreading this. In the meantime, no one's showing symptoms, no one knows they're infected, everyone swears they're really, really good at social distancing, they're still going to grocery stores and making essential trips. So one tiny indiscretion or accidental infection can now spread the virus through several households. Right now, we're looking at a median RO rate of 5.7, which means that one infected person is likely to spread the virus to 5 to 6 people. Each of those people is going to spread it to another 5 to 6 people, and we're looking at actual exponential growth. So this is why social distancing works. If we can contain people's networks to within their own household, we can severely limit the spread, limit the deaths, and contain this. But every small break, be it a date from 6 feet apart or just visiting a partner you don't live with, significantly breaks the containment and increases the risk for everyone. We can't completely self-isolate. Some of us are essential workers. Sometimes we need to go for groceries or head to our mailboxes. But each time we leave the house, we risk both contracting and spreading infection no matter how careful we are. So when we talk about risk and assessing risk, it's important to note a couple different things. We can't completely eliminate risk. Reduction in risk is the goal of social distancing, and we can't accurately or safely assess individual risk because we can't take into account all of the potential variables and sources of infection. It's extremely important to limit contact with non-cohabiting partners, as difficult as it is, to prevent and contain the spread and protect not only ourselves, but those around us.
Wonderful. Thank you so much, Aila Moireach. We have Dirty Lola next. Storyteller, sex educator, sex toy peddler, and creator and host of Sex A Go Go.
Hey y'all. So just to start out, I want to let all of you know I'm not coming from a place of privilege right now. I don't live with a partner. I live on my own. The last time I saw any of my partners was January. So this is not coming from a place of having someone to cuddle up with or even go see. I also live in New York, and I am in a pretty inaccessible place, even by walking, to go to anyone's house. So any kind of contact I would make with another human that I know would mean traveling a distance. So this isn't coming from a, like, I have people I can talk to place. I'm talking about how the risk assessment models that we normally use in what we do based around STs and STI contraction just don't work for COVID. I know we want it to. I know that we think that we are better and infallible because we always practice good health practices, or at least we're hoping we are. And we think because we practice good consent models and we're talking to everybody that we're going to be okay just going to someone's home. And like Aila said before, that's just not true. We also need to take a step back and realize that our decision-making processes right now are colored by loneliness, anxiousness, depression, all of these things that are really not making us good decision makers right now. I'm also hearing and seeing a lot of people making assumptions around, but I'm healthy. If I get it, it won't be that bad. We've heard about people who were runners and who were very healthy getting sick and dying. At least I have, and I've been trying to watch the news and stay on top of those things. So those assumptions of I'm invincible because I'm healthy and I'm taking zinc and I'm drinking, elderflower, I'm gonna be okay, you're wrong. This is also, we're making an assumption of immunity. I've heard people talking about, well, I think I was sick, so I might be immune. The thing is, if you say think and might, those are two words in the English language that means not 100%. And if nothing is 100%, you can't make a proper risk assessment. So we need to step back and think about those things when we're making risk assessment. If we're saying maybe, might, probably, you need to stay home, because all of those things don't equal 100% safety. When we are making our risk assessments, some of the stuff that we're looking at, we base it around chances of contraction. We base it around knowing how to protect ourselves. So barrier methods and their percentages of success and failure. We look at the history of contact, so who we've slept with, who our partners have slept with, who people have come into contact with. And we also make these decisions based around treatments. So if you know now, AIDS in the 80s when I was growing up was a death sentence. If you got it, you weren't making it. So people were very careful about who they slept with. Now we have PEP and PrEP. I just took my pill before this talk. So now when we think about sex and contraction rates for STDs, we can be a lot more open because we know we can go get an antibiotic, or we can be on PrEP or PEP. All of these things color our decision making. You can't do that with COVID. Number one, the information that's available is ever shifting and changing. They say one thing one day and it's exactly a new thing the next day. We were told not to wear masks 2 weeks ago. Now there are states that are giving people tickets and kicking them off of buses because they're not wearing masks. There's so much different information around masks and how they work. Like if you're wearing a cloth mask, it's not protecting you from the virus, but it's protecting you from spreading your droplets further out, not completely, not 100%. And so there's a lot of misunderstanding around how these barriers work. So it's not like condoms where we know their success rate and we know that if we use it, these are our chances. We don't know any of that right now. We have a good guess. The CDC is giving us guidelines. Those guidelines change daily. None of this is concrete information. Like right now, you can go on Google and look up chlamydia stats, and you can make your decisions around whether you're willing to risk getting chlamydia or herpes or anything else based off of solid numbers. We don't have that right now. So you can't use this as part of your risk assessment. It's also harder right now to track history because we're not talking about person-to-person contact. You don't have to hug somebody to spread this. You could be in the grocery store and somebody coughs down the end of the aisle. You could be at ringing out. It could be in your elevator. If somebody coughed and got off the floor before you, you wouldn't know. I live in a 22-floor building. We have elevator protocol, but I don't know who was on the elevator before me, and I don't know, and people who get on after me don't know that I was on the elevator. So all of these things equal big question marks in my risk assessment. So when people say, can I come over? I will drive to you. I've been in my house. I'm like, yeah, the moment you hit the street, it goes back to zero. I'm in the house. I go out of the house 1 day a week, if even that. But I know that that means I'm back at zero. I'm back at zero and I could be sick. And we have to operate under the assumption that we are sick. If you are leaving your home base at all, even to get the mail, you set back to zero because the world outside of our homes aren't 100% sterilized. So if you're back at zero, that means you can't go travel to someone outside of your home base and safely interact. Thank you.
Amazing. Thank you so much. That was very informative. All right, next up, we have the consent warriors, Zach Budd, founder and CEO and Supreme Spacer, love you for that, of the Space Force, consent warrior, aspiring social worker.
Yeah, thank you so much. I really appreciate you guys doing this. Zach Budd. I live here in Houston, Texas. That is a mural on the side of the Graduate College of Social Work at U of H behind me there. I was asked to talk about this from sort of the standpoint of view of being a consent educator and consent models, and particularly the one I know most is my consent model. Anyone who's been to my workshop, I'm not going to go through it, there's the 5 pillars of consent, basically the 5 important things that you have to have for essentially consensual interactions with human beings. And I do frame it like that. All human interactions have a modicum of consent involved in them, which means there's negotiations involved. I'm only going to go over basically 2 of them, and truthfully, mainly just one, because you can't do the other without the first one here. So it's that informed part. One of the key parts to consent is that people have to be informed of what they're consenting to. So if you think of it in a framework from having interactions with other people and proposing interactions with people, in order for someone to consent to an interaction, they have to be informed of what the potential risks and benefits are. In the world of a COVID-19 pandemic, the problem is we just don't know the risks right now. We know the risk of catching the virus, but it is way too easy to get it. There are still, even though we have a lot of information, clearly, as we learned from Aila, there's a lot of scientists that really have a lot of information about this. We're still, as Lola said, not knowing. Things are changing every day, and you don't really know how much danger there is. Literally every time you walk outside of your house, there's a risk. I'm relatively fortunate. I've worked from home since September, so that's not a big deal. I live alone with a dog, but hey, trust me, I'm in this with everybody else. I miss my partners. I've got partners, some nearby and some afar, and I miss every last one of them. Haven't really seen anybody in person in a while. I've got an elderly parent. My mother lives a half mile away. Herself has a few risk factors. I can't get near her. I want to go and check on her and make sure that she's okay like I normally do, but the reality is, even if I feel healthy, I could be a vector. I could be carrying something. Walking out of my house, I may touch something that could cause an infection, and the last thing I want to do is be a vector to somebody else. It's bad enough if I get myself sick, but getting someone else sick is kind of the issue. The other thing, and if I can put on my social work brain for a minute here, we're all part of a human family, and we are all going through this shit together. So we really have to try to let go of the individual's thinking. I know sometimes whenever we're talking about consent and individual interactions, it's just the people that are involved, but you need to understand, as was pointed out by the previous two speakers, this isn't just about you. I mean, I may be dying to see my partner. Okay, fine, I'm gonna go see my partner. But if I go see my partner, everybody I might interact with between here and there becomes either a potential, someone that I've been a vector to, or someone who could be a vector of infection to that partner. If I've got a partner nearby that lives in a house of 4, now everybody in that house is been infected, let alone if a week later I just happen to drop by my mom's house because I think she needs me. You never know. We literally are part of the human family, and everybody has a responsibility of making sure that we are keeping each other safe. And so it's less about making decisions for me and more about everyone else. So when you're having your negotiations, when you're assessing risk, it's not just you and not just the people that you are intending to go see. It's literally everybody you go by. I was begging my mother not to go grocery shopping. Not so much that I was worried about her not being safe, but there are too many damn people in grocery stores right now. And everyone is doing the same thing. Now she lives alone, I live alone, and I said, Mom, let me Instagram it and I'll drop it off in your garage or something. But the reality is we've got so much potential to get each other sick, and we are social distancing not because we're trying to prevent the disease, but because we're trying to slow it down. This thing is, drop kicked our country. It has exposed how bad our healthcare system is, and a bunch of other ineptitudes I don't have time to go into. But the reality is, we just cannot be fully informed about these decisions we're making. Not only that, other people you interact with cannot be fully informed and can't consent. If you go see a partner, they can't then know how many other, basically the risk increased. You don't know how much the risk is increased the minute you step outside the door. And if you're not informed, then consent cannot be voluntary. You just don't know what you're consenting to. Therefore, it can't be full consent. It's just, a matter of thinking about essentially the collective more than yourself. I get it. I know I'm dying to see my partners, and many of them I don't know when I'm going to see again. And it hurts. It sucks. But I am doing the best for everybody involved, including the ones I love and myself, by minimizing the risk as much as possible. Period. You can't consent to what you don't know about, and we just don't have enough information. So that's what I've got on this right now.
Thank you so much, Zach. Yo, we were dropping truth bombs up in this Zoom. Just wanted to hype up the room like that. This is great. And I feel like I'm with all of you. So, and all of you 72 plus people who did join us in this Zoom from the beginning, you are with us. We are together in this room. All right, next up, we have Libby Sinback, relationship coach and educator.
Hi, everybody. So I just want to check in with everybody because I want to thank the previous panelists for bringing a lot of really valuable and needed information into this conversation. But I just want to spend a moment. If everybody would like to, I invite you panelists and participants to just take a moment and just close your eyes if you'd like, and just take a breath with me here, okay? Just take a breath, because that was all a lot, and it's all really important stuff, and I want you to just take a breath and let it land with you, okay? Now, just do some normal breathing here. I want you to just check in with what you're feeling in your body right now. I'm wondering how much you have done that over the past month. Just checked in with how your body is feeling right now. One thing you might be noticing is you might be feeling some tension hearing about the current situation. I know every time I open up the news or look at my Facebook feed or talk to someone I care about what's going on, my tension, my anxiety, my fear, lots of emotions kind of come up. And I think that as a community, as a global family, we are in crisis mode a lot. And the truth is that when you're in crisis mode, that is bombarding your body with a lot of intense chemical concoctions that can really do a lot to you. And it's definitely these chemical concoctions like adrenaline, cortisol. These are stress hormones, and they're designed to be released on a short-term basis to get you out of a dangerous situation, like a bear chasing you or somebody trying to fight with you and you need to protect yourself. But in this situation, we're in a protracted, stressful crisis, and we're probably being hit with overwhelming feelings all the time. And a lot of things that can be happening to you while that's going on are, you might be more easily triggered. You might even find yourself reliving trauma. You know, we are all, a lot of us have trauma in our background, and some of the things that are happening right now might be deeply triggering to you. Being alone. I've seen a couple questions come up on the chat of, I'm solo poly, I'm alone, I'm worried about my mental health, I'm worried about, like, I rely on emotional support from my people. How do I handle that? We'll get to that question, but I just want to point out that there are a lot of different ways in which people might be under a lot of stress. Being alone is stressful. Being cooped up with the same 3 people can also be stressful. We are in a collective stress situation. And there's not an easy way to fix it, right? Because as we pointed out, this is a situation where there's not an answer to fixing it that is going to come right away, because we're in the middle of it right now. And it may go on for a while, and we don't know how long. And that uncertainty of how long is it going to be before we're through it is probably part of the stress. So the thing that I want to encourage you to do as you're moving through this time, because when you're stressed, all kinds of things happen to your body that impact your ability to make decisions, that impact your ability to be generous and kind with other people, that impact your ability to take care of yourself, is to close your eyes periodically throughout the day and take a breath and just check in with yourself. Because it's really important for you to notice where you are. Yeah, I gotcha. And be where you are, and be kind to yourself, be forgiving of yourself, and really do your best to not be constantly living out of your stress and be in this reactive state, because it's not where our best decision making happens. It's not how we're going to sustain our relationships through this crisis, because we really need each other right now. As much as people are saying stay away from the people you love, that doesn't mean don't connect to the people you love. It doesn't mean don't talk to people that you love. It doesn't mean don't get and give support. We really need each other right now. So do your best to be present to your body, be present to your stress, be present to your triggers, and take good care of yourself. That's what I've got for you. Thank you.
All right, thank you, Libby. Up next, Dwayne Smith, computational sociologist and PhD candidate. Take it away, Dwayne.
Hey everybody, how's it going? First, I want to thank Chrissy and everybody who brought this together with like 48 hours for this great panel of good information. So a little bit about me. I tend to study the politics of sociology, if that makes any sense. How laws, political ideologies, and ethics and community events affect people on the margins, marginalized groups, minorities, and economically disadvantaged mostly. So what does that mean? That means that today you get to hear me talk about active allyship is what I want to get through. And what do I mean by active allyship? I mean, everyone before me kind of hit the nail on the head. We are all in this situation together. We are all stressed. We are all feeling anxious. We are all feeling depressed in some points. And we're not in an environment where it's possible to be our full selves as much as we would like to. So with that being said, while not everybody is being their best selves, it is important that since we're in this together, that we look out for the people who are more marginalized than others. We all enjoy several privileges within ourselves, myself being a cishet presenting male, regardless of my skin color. Everyone enjoys a certain level of privilege within themselves, and it's incumbent upon us to look out for those who don't enjoy the privileges that we have. And what does that mean? So there's two ways I see of being an active ally. The first is external, second is internal. So I'll talk about the external first. And the way I'll talk about this is what my partner calls or says, say something in the moment, right? We all have places we need to be outside of our house. We have to get groceries. We may have to run to the bank. We may have to do something. We may have to be in public, even though it's not the safest place to be at this moment. So while we are out carrying on, we have to look out for the things that are threatening to more marginalized communities. We've seen in the news how Asian presenting people are being attacked openly in broad daylight, randomly, everywhere. It's just insane that these things are happening, but it is true. So while I'm not advocating put yourself, like, nobody be John Wayne, don't put yourself in a dangerous position, but say something in the moment. If you see someone arguing with someone or shouting slurs at another person, just say something. Say something to the person, say something to the security if you're in a store, say something to someone. Say something in the moment, do something in the moment. The second thing as actively is, let's say you do find yourself in the hospital because you or someone you love, you're in the emergency room, someone you love is not feeling well. Well, story. I tend to tell stories a lot. A few months ago, there was a woman with flu symptoms in the ER saying that she couldn't breathe and was ignored. It was a Black woman. The ER staff pretty much ignored her and she died on the floor 6 hours later. That's another thing of saying something in the moment. If you see somebody who seems to have their pain or their anxiety in the emergency room being ignored, say something, because people can die from this. Then I'll go into internal, which won't take me that long. I see I have a minute left. The internal is checking yourself and checking your own privilege, to be blunt, right? If you see, there are a lot of people who are choosing to wear masks in public and those who are not wearing masks in public. If you see somebody not wearing a mask in public, they may have made that choice actively. I personally don't make that. I don't wear masks in public. Why? Because even though I have privilege as a cishet presenting male, I also am Black, right? And it's not always safe for me to wear a mask in public. In fact, there are stores in several places that say don't wear masks. So in highly Black communities. So say something in the moment, be active externally, and check your own privileges and your own biases, and be an active ally internally as well. That's all.
All right, thank you so much, Dwayne. Taking a lot of takeaways about being aware of yourself and aware of other people. We have to be aware of other people despite how hard it is being isolated from them. Next up, we have intimacy con amore, community/disability/polyamory advocate and conference organizer. Go ahead. Oh, your mic is off. You unmute yourself. There we go. All right, you win there.
Thanks. Hi, thanks for joining. Thank you to Chrissy for putting this together and having all of us here. Thank you to all of the attendees for making the time to just be here, be present, listen, and then share this information later with people you know who will listen to you, who are not doing what's best for our collective earth all together. I was asked to speak to my life. I am disabled. I have multiple invisible disabilities. And sometimes I use a walker, and sometimes I'm so ill, it just literally takes everything to get out of bed and take a shower or feed myself. And so being polyamorous has been a benefit to my health my whole life, because having multiple partners who love you, check on you, drop by, bring groceries, drop off soup, take you to the doctor because you don't have the energy to drive yourself to the doctor. Like, those things have become staples in my life. And now, because of this, I self-quarantined March 2nd. And then March 5th, I got sick. And then I was sick until April 2nd and didn't find out until I was able to reach my doctors because I was afraid of going to the clinic and spreading whatever was making me sick to someone else, or catching COVID from someone who was at the clinic. But comes to find out, according to my doctors, I had it, but I didn't know that at first. I thought it was like allergies. I thought it was just a sinus infection. I thought it was my asthma, like all these reasons I kept like, oh, this is just normal sick shit that I go through. And turns out my doctor's like, no, you had COVID. And so then talking with family members, it turns out a lot of people in Dallas were traveling across the US, and people we know had it when we were out of town in December, January, February. So it's funny how everyone's like, oh, we're on lockdown now. But the thing is, it's been being spread for months, and now it's a problem. And so I am here to speak to those who are not sickly and think, oh, I'm healthy, I can go out and I can do this. You can, but you need to take all the precautions like you're a sick person so that you're not spreading this to other people who are sick that you can't see they're sick. I don't look sick. Like if you look at me right now, I don't look sick. You don't know that I have all these invisible disabilities and my immune system is for shit, right? So I'm just here to urge everyone to think outside of the box and don't just like live comfortably in your privilege, that maybe you have a day job that you can work from home so your income hasn't been affected. Maybe you have great health insurance in case you do get sick. Maybe you have access to go and get tested because you can pay for it. Like there's so many other reasons that people are gonna die from this because they don't have income. They're immunocompromised. They live in a community of color where no one gives a shit and there's no access to medical help when you need it. I'm trying not to cry. And then being polyamorous and having healthy partners who are basically house hopping and going on dates. Like, y'all gotta cut that shit out. Because I'm sitting over here like, it's a blessing that I'm quarantining myself. I'm making a point not to have access to anyone other than my children and the partner that lives with me. And I'm blessed to have a partner that lives with me. So just be mindful and think about the things that you do and the choices you make, because everyone's watching. And at the end of the day, when this shit ends, if it ever ends, we're all gonna remember who was mindful and who wasn't. And you're gonna have to answer for that. Thank you. Be blessed.
Wait, 1 minute early. Good work. We're all in support. We're all here for you. And I know definitely I am here for you because I have the privilege of knowing you personally. How? All right, next up, we have Dr. Eli Sheff, educational consultant and expert witness serving sexual and gender minorities. More things to be aware of. Let's go.
Hey, hi there. I'm Dr. Eli Sheff, and I have been researching polyamorous families since 1996. And one of the most important findings I have is that metamors are incredibly important, meaning the polyaffective relationships between partners who don't have sex. Those are often the real glue of the family over decades. So in this time of distress and pain, don't forget your metamors. I recommend, in fact, Zooming with the entire polycule when possible, because those larger network, partners can stay in touch with each other, and that's important, definitely. But don't forget the rest of the polycule. Include that larger network of support in your interactions while you are affected by the quarantine. One of the folks asked about custody, children shifting back and forth between households, and that is tricky. In part because one household might be very aware of quarantining and doing, sanitizing their groceries and things when they bring them in, and another household might be like, well, we're young and strong, so let's go play Frisbee in the park or something, So balancing, it's kind of the parenting differences that already exist magnified by the current distress. I would say, for one, absolutely follow your custody schedule. Do not take this time to rock the boat, in part because kids need that stability. Kids need that familiar, this is the way things have always been, and I know the world is freaking out, but some semblance of pattern right now is good for kids. So don't cut them off from their other parents. Even if you have a hard time talking with that parent, be sure to at least discuss what kinds of precautions are you taking? How are people in your household feeling? Possibly be prepared to answer your kids' questions like, why do you sanitize groceries here and there? We go out and, we went to somebody else's house and had dinner. Answer that question as much as you can without vilifying the other parents. It could be tempting to say, well, obviously they've got their head up their ass. They should be being a lot more careful. But you can't really say that to a 6-year-old or a 7-year-old. So you might say something like, we're just more concerned about the virus here. We're concerned about spreading it or getting other people sick. So we're taking a lot of precautions, In general, I would say about COVID and all other things polyparenting, give your child honest and age-appropriate information, and it's hard to go wrong. Good luck, everybody.
Since you ended so early, there is a question in the
Oh,
chat.
wait, okay, I have more time. Okay, let's do the question chat, and then if I have more time, I'll talk about long-distance relationships.
What if the kid doesn't want to go to the other parent's house right now due to the coronavirus?
If that other parent is not litigious and you can come to a positive agreement so the kid gets to be where they want, fantastic. If that other parent is highly litigious, I would be very careful. I would talk to your lawyer.
Okay. All right. Thank you so much, Dr. Eli Sheff. I personally am a fan of your research.
Thank you too.
Thank you. Next up, we have Amy Moores, co-chair of APA CNM Task Force, assistant professor of psychology, research fellow at the Kinsey Institute. Thank you, Amy Moore. Welcome.
Hi, everyone. So I've spent the last 11 years of my career studying diverse expressions of sexuality, including queer relationships, poly, open, and swinging relationships. I come from an intimate justice framework, so I fully believe that people should operate in society and have family and intimate lives however they want, as long as they're consenting, without social, economic, and legal persecution. And part of my job as a psychologist is to understand human behavior. And so right now, my colleagues and I are in the process of developing online surveys for people engaged in consensually non-monogamous relationships to better understand how we're managing connection during this time. I'm interested to learn what all we're doing to connect with our partners, to connect with our friends, our families, and to help better identify resilience factors early on. So what are things that we are doing and how can we share that knowledge with other people? So that's my goal right now, is to start studying this early, because as we're all quite aware, this social distancing for at least long periods of time are going to be a part of our life for the next year, if not more. And so understanding, really healthy coping strategies early on will benefit all of us. And so for those of you who are interested in taking part in this study, it's still currently under development and it will go through IRB, institutional review at my university. But I think it's critically important right now, because I have so many people here, if you're interested in taking part in this study, in the chat, I listed bit.ly where you can leave your email address so I can send you an email once the survey's ready. But then I also ask, are there any challenges or positive aspects that you think should be looked at during this time? And to do it old school, I put a little bit.ly here. And so I did COVID poly, and you can sign up to take part in the research, and then also let us know kind of what's going on in your life or what's a bigger picture that you think researchers should be very mindful of during this time. And I look forward to seeing all of your responses and to, you know, continuing to serve the community.
All right, it's fast. You had like 3 minutes left. Is there anything else you wanted to add?
I can talk about different research as well as Eli did. So right now it's unprecedented. We don't have research on how people are managing levels of risk or how to communicate in these different ways under heightened economic and health stressors, and especially in the context of consensual non-monogamy. But some of the things that I have been anecdotally picking up, so I'm doing a content analysis on different Reddit threads of what really creative things people are doing to stay connected. And so things, I don't know if it's particularly people engaged in non-monogamy are quite, but I'm seeing really, really interesting things where people are going on, you know, lots of virtual dates, but, you know, in like Animal Crossing, different ways to do dates and stay connected. Zoom is big. There's also different like house party and things like that, where that's a running sentiment out of the things that other people have been saying to stay connected, even though we can't be physically together.
All right, awesome. Thank you so much. Thank you so much, Amy. And I want to point out to all of our attendees right quick, some of you are using the question and answer function. For the people who are putting questions and answers in the chat, I'm afraid it might get lost. So if you can scroll to the bottom of the screen where you can see the speaker speaking and click on the Q&A, you are able to input a question there, and we can get to it at the end of the presentation. So with that said, next up, Alan M. We have the creator and curator of Polyamory in the News, a major polyamory media outlet, and PLN, that is Poly Leadership Network, administrator. If you could, welcome.
What do you do? Well, what I was asked to talk about was the media landscape that currently faces us. And I have, of course, by unmuting my microphone, I lost the thing that was on screen, and we're now going to find it in just a moment. There you go.
It seems that it would be beneficial if you were able to speak up a little louder.
Yes, here we go. I get closer to the mic, louder. I run the Polyamory in the News website since 2005. It has about 1,600 posts now, about nearly 4,000 newspaper and magazine articles, TV broadcasts, radio interviews, and other media treatments of polyamory for the last 15 years. And I also maintain Alan's list of polyamory events, which the listings now are filled with red postponed and canceled notices. About the media landscape that exists for us right now, that gives us opportunity to use our media to reach our messages out to consensual non-monogamists of all kinds, and drive home our movement's key values to the general public. Some years ago, Peppermint in San Francisco wrote a long essay titled "The Strange Credibility of Polyamory." He pointed out that compared to other non-standard sexualities and relationship forms, poly people were beginning to get remarkably non-hostile media treatment. Maybe it was because we talked in public so earnestly about love, and Ralph Waldo Emerson said all the world loves a lover. But mostly, I'm sure it was our earnest talk about things like, communication and honesty in relationships, the centrality of good ethics, consent, gender equality, serious STI awareness and prevention, compersion, and other stuff like that that struck a chord. And of course, We've been great for media ratings, especially in the last 3 or 4 years. We generate clicks. Our basic message really turns heads that multi-loving relationships done with everyone's buy-in can actually succeed beautifully for certain people, but don't expect it to be easy, and here's how. The only real hostiles remaining for us in the media landscape these days are ideological cultural conservatives and hardline religionists. So now with the COVID pandemic, to the extent that media are going to take an interest in our particular situation in this at all, we come with fairly big favorables in their eyes regarding character and integrity. At least the organized poly movement does. So now in this time of crisis, we have some political and moral capital that we can use. It's our first job to live up to our own best standards and our own communities, in our own communities, as the pandemic's moral and political crises are beginning to seize the world. The need for social distancing, not just for our own safety, but everyone else's. The need for societal equity and the need to put people over profit just because they are people, whoever they are, is a test of character that some are passing and some are already failing. We have a real message to bring that love is about concern for others, for all, not just for one you love. For poly folks, quarantining poses special challenges and complications and tests. We need to pass those tests and to be seen modeling good epidemic control behavior, doing our bit to protect each other and the wider population from both viruses and exploiters, especially modeling good action within the consensual non-monogamy world for those who might be wavering or who go spouting pseudoscientific justification for actions that spread disease and can kill people around them. This is the exact same fact denial and science denial and circular motivated reasoning of Trump and his followers. We can't do much about the White House, at least not for another few months, but let's not be afraid to use social pressure, honoring and shaming to steer our own community's direction. And the media are interested in us enough that with care, we can use it now to spread our voices.
Thank you so much, Alan. All right, that was wonderful. Very well prepared. Oh. All right, next up we have Rachel Waters, Director of Communications at URGE, that's Unite for Reproductive and Gender Equity. Thank you for coming, Rachel.
Hello, everyone. Thank you so much for tuning in. I'm going to piggyback off of what Alan said and just illustrate for everyone just a few things to keep in mind if you do get approached by media or if someone refers you to media during this time. This is going to be a little less COVID focused and a bit more just media training focused in case you don't have experience speaking to the media. I think one of the most important things to do if you do get a request is very briefly take a moment to get to know your reporter, right? You want to ask them what their story is so you get an idea of the angle and get an idea of the kinds of questions that they're going to ask you. You don't need them to send you a whole list up front, but just say, hey, what are you looking to find out? You also want to know the outlet they're reporting for or the potential outlets, and that'll give you an idea if they're a friendly or not, or as Alan really artfully pointed out, someone who's knowledgeable or not, because we're not facing a lot of hostile people right now, but there is still a lot of misinformation out there, and even a really well-meaning reporter, let's say they come from USA Today instead of Broadly, right? They might be a little less knowledgeable about poly, and so that can help you prepare a bit. And when it comes to preparing, you want to make sure that you know your story, right? That social responsibility narrative, if it's about COVID, that you want to emphasize that you are doing your part to flatten the curve in terms of your behavior with your partners, your metamors. Also, know what topics you want to clarify and stereotypes that you want to confront. This is your shot to educate others about the poly community, always. Also, think about who is going to be speaking and consider representation, right? Let's say you're a cis man. Think about making space for your female, trans, or non-binary partners to speak. White folks, ditto if you have partners of color, right? Also, think of some other possible sources to refer the reporter to as well. Sorry. Reporting here from the epicenter of Queens. There's going to be some emergency vehicles that go by here and there. You want to be able to still shape that narrative and keep it in mind. And when you are thinking of people to refer them to, think of maybe non-heteronormative pairings and groupings of people. Also, again, consider less commonly depicted relationship types. Think of, queer polycules, bi men, non-neurotypical folks, people of color, again. But before you refer a journalist to anybody, make sure you get the consent of the possible subjects before you send a journalist that way. You don't want anyone to be caught off guard or be surprised. But if you have some friends that you think are good sources, say, hey, I've got this reporter from Vice or what have you, and they might be interested in speaking to you. Would you be comfortable with that? This is what it's about. And that's a really great way to go ahead and help broaden that narrative and to continue that process of educating through media. Once you're actually in the interview, you want to project calm, openness, speak confidently, don't use words to fill the space. And once you've answered a journalist's questions, just stop talking. A lot of people tend to ramble, and when they start to ramble and fill extra space, that's when you can kind of screw up the narrative, right? Again, confront stereotypes at every turn in a really frank and honest way, and practice bridging to refocus the conversation if they start to kind of go off in a direction that could be potentially, painting a narrative that you don't want to paint about the poly community. So you can say things like, oh, that speaks to a larger point of this, or, well, the thing is, and then you can redirect that narrative back. I think that during this time, and when it comes to journalists speaking to poly folks in particular, there are a few danger zones to be on the lookout for. One of the first things is being on the lookout for language that makes assumptions or applies monogamous or other normative frameworks to your relationships. Be on the lookout for words like committed partner or serious partner, or inserting hierarchical language like primary or secondary if it doesn't apply, or using nonsense terms like poly couple, right? Firmly but kindly correct them if that kind of language arises. You want to be a resource at all times to educate them. Also, beware of leading questions or ways of phrasing that encourage you to validate their stereotypes or beliefs. If they say something like, oh, so poly people do this? Are you telling me poly people act or feel this way? You want to be clear that you are speaking for yourself and you are a representative of a very large and very diverse community, and your views and your ways of being are in no way reflective of the entirety of that community. And that's about being a responsible representative for our communities, right? Also, one of the things that I often see in even well-meaning and positive poly coverage are these overly sexual focus, an overly sexual focus on language and photos. I am all for sex positivity. I am a slutty slut at heart, but poly is not inherently lurid. We know that. And we want to kind of be mindful of not perpetuating that stereotype that poly is all sex focused. Maybe mention about asexual folks who are also in poly relationships too. Really throw a real monkey wrench in there just to show that not all poly relationships look a certain way. Also, again, don't out people ever without their consent. That includes your own partners. For example, both of my partners, they happen to be monogamously oriented. I've been with them 5 and 6 years respectively. They are only out to friends and select family members. They're from more traditional Southeast Asian families. They work in relatively conservative fields, so they don't make any media appearances with me, and I'm very careful. I even spoke to them before doing this about, hey, what are you comfortable with or not? Because I'm very cognizant of not putting them before an audience that they are not prepared to meet. So always keep that in mind.
Thank you so much, Rachel. All right, next up we have Jennie Mae, I hope I said that right. Jennie Mae, communication strategist and mutual aid organizer, specializing in medical solidarity, community safety, popular education, and skills sharing. Welcome. Thank you so much for joining us. You can unmute your microphone. Thank you. All right, take it away.
Hi, everyone. I was asked to come and speak to you all about mutual aid disaster relief, both as the network and organization that I work with and as a verb, and what mutual aid is and what poly communities can be doing right now to contribute to these networks of neighbors helping neighbors springing up all over the country. I know that a lot of people really want to help, but they don't know where to start, especially with a crisis of this magnitude. A lot of people feel as though the contributions they would be able to make maybe aren't enough, or that they don't know how to organize something like this, and that fear and lack of confidence is keeping a lot of people from being able to do, what's in their heart to do to help their communities. So I'm here to kind of provide some insight into how we can all do something to help, even from our various locations and our multiple marginalizations, how all of the skills that many of you already have that you might not realize can be adapted to a task like this are actually really, really useful. And a little bit about that specifically in the context of the types of organization skills that many non-monogamous people pick up just by dint of balancing and organizing their lives. I like to say to people, if you can organize a themed party or a group camping trip, you can organize food solidarity for your neighborhood. And this doesn't have to look like having a ton of time or ability to spend outside or to go outside. This doesn't have to look like having a well-oiled machine of dozens or hundreds of volunteers, or being recognized by the local media. And in fact, very frequently the efforts of marginalized people don't receive any recognition whatsoever. It can be something as simple as committing to checking in with your neighbor. Perhaps someone on your street is an elder, or is immune compromised, or is otherwise unable to leave their house, or is in a situation of financial precarity or of some kind of scarcity. And so it can be something as simple as just, committing to checking in on one person, or to sending, when you have the capacity to do so, sending supportive messages to members of your community who are dealing with this collective grief that we're all feeling. I think that naming that collective grief is also part of our community and collective care process right now. We all feel as though something is very wrong. I've had a lot of people say this to me. We know what's going on. We're scared. And I think that we can turn that fear into something that we use to ensure that a better world emerges from this crisis, if we have the tools to do so. But the good thing is that those tools are available to us, because those tools are each other, and our connections to each other and our communities and our loved ones, and the friendships and genuine solidarity that we build with the people that we meet every day. And so, I've seen people saying, I'm doing things like checking in on the people next door. I'm updating a list on social media of which grocers have items that have become scarce that people need, or I'm collecting donations for the single mom who's having trouble with diapers. These things that they feel like aren't these large scale efforts that they're seeing in the news, that they feel like aren't enough. And one of the reasons I agreed to do this panel was to come here and to tell all of you, any of you that are doing that, any of you who have given a consistent and intentional care for someone outside of yourself in this situation, are doing mutual aid. You are making a difference. You are planting your seeds, and they will grow in ways that you can't imagine. But also specifically, like a lot of poly folks, like theme parties, like play parties, like conventions, and have this kind of like event organization background. A lot of people are very used to, creating calendars to ensure that they're able to spend time with their partners in the ways that are meaningful to them. And all of these skills are at their root organizational skills that can be applied to rapid response around many kinds of issues, around disaster relief or medical solidarity for those in our communities, or responding to the needs of houseless populations, your skills are cross applicable. When I first began disaster relief work, I thought that a disaster relief worker or mutual aid worker must be some superhero combination of a firefighter and a paramedic and a soldier and a lumberjack. But, you know, that was not the case. And I very quickly found out that not only were there things that I could do to help without having any of these kind of very glamorous skills, but that skills were available to me, and that there were people who were willing to democratize knowledge and teach as much as I was able to learn. So I don't want to take up too much of your time, but I do just want to encourage us, while we're talking about ways that we can help keep the community safe by actions that we take or don't take, that some actions we can take are as simple as just making sure to look in on your neighbors, to link up with your polycule, with your community, and talk about how you can redirect your energies right now that maybe would have gone to cocktail events or play parties into ensuring that children have food to eat tonight. We need everybody. There is no hierarchy to who can help. There may be a hierarchy to access, but everyone's contributions are meaningful. Your contributions are meaningful, whether you were able to leave your house or not, whether you're only able to save the person next to you or to build something that impacts your entire neighborhood. It all matters. And so if you're interested in talking more about that, I am very reachable on Facebook. You can find me at facebook.com/pyracies, spelled in the old way, PYRACIES. And if you want to learn more about mutual aid disaster relief and get some guidance and support and how maybe you can start mutual aid distribution in your own area, you can visit us at mutualaiddisasterrelief.org. We have a listserv, a Slack, a Signal loop, Facebook group, all kinds of ways for people to plug in, link up with people in their area, and access a lot of resources on how to help to the best ability wherever you're at and in whatever ways you're able to offer.
All right, thank you so much, Jennie Mae. Before we wrap up into a break, before I take it away for Chrissy to lead us back into our break, and then we'll answer the questions from the Q&A and best we can access from the chat after the break, I wanted to jump in a little bit and tell you my 2 cents, a little bit about myself, a little bit about what everyone else has touched on. We, as much as we are feeling personally like separated from our partners, it's, as Jennie said, it's great to redirect our energies to the community and what we can do for everyone around us, for the people that we can help, if anybody, for people that we can connect to as we tap into the community grief. I think that's very important. The more something that Avita said on a live yesterday, talking about grief, since she's taken courses on grief and being a grief doula. Avita is a wonderful person to follow, by the way, Avita Levitica Sawyers. She mentioned that we cut each other off whenever we judge someone or something. We cut ourselves off from it. So do our best not to judge other people for whatever practices they're doing. We're not always aware of what safety precautions they're taking or not taking, but that will isolate us further. So that's something to take away and like self-assess within ourselves. Just because this pandemic happened does not mean that the system of the country that we're in, since most of us, I think all of us are in the US, didn't go away. All of the systemic racism is still there, and all of our injustices are still here. And if anything, this pandemic is going to heighten it even more. We have to be aware that there are people that still need to go outside, and they're still going to be subject to the same racism that they did before. They're still going to be subject to the same sexism and all the other isms. As Dwayne pointed out, there will be people in hospitals who are being ignored. And when you put the collective together as much as we can, there's there's a concept that I am volunteering my services for as a Chinese traditional medical practitioner. The US is ignoring and has always ignored Chinese medicine as a legitimate medicine. We wonder why China's death rates are so low. We don't know if it's a counting thing, but they also use traditional Chinese medicine in their country. It is not profitable to big pharma in this country, so it has never been implemented. Now, I didn't go to school we all have a minimum of a 4-year master's degree, and some of us a doctorate degree in traditional Chinese medicine, particularly those of us who did the herbal certification as well. I didn't go to school for 4 years to give you a cinnamon stick. We can actually give you traditional Chinese medicine herbs. These herbs can be IV'd in hospitals, and our medicine is being ignored. So in this time where hospitals are filled, if any of you are suffering at home and you need herbal prescriptions sent to you, contact me or any other acupuncturist you know that does herbs. Anyone. I will send you herbs. I will, and this will present differently in everybody. So I can't give everyone the same herbs because holistic medicine actually looks at the overall health. So with that said, I'm Parnia. I'm gonna pass it over to Chrissy. Take it away and lead us into our break. After the break, we will be addressing all of questions.
Thank you so much. And thank you again to all of the panelists. You've been spectacular. We're gonna take a 15-minute break. Go get your food on, get your bathroom on, do what you need to do. And then when you come back, we're gonna be answering questions from the panelists. What I need you to do is go into your Q&A. That's a selection down at the bottom of your computer screen. Type in the question that you have. If you wanna use a particular name when we're addressing your question, or you just wanna keep it anonymous, put that in there. And if you want to address a particular speaker, put who you're trying to get that in. I can't guarantee that you're going to get that speaker wants to answer the question, but we're going to do our best here. So everybody hang tight. We'll be back at 2:30 and we'll see you all soon. Thank you.
All right, and we're back. Welcome back. Welcome back, everybody. Just waiting for everybody's video to be back up. I got the questions back up. I'm gonna do my best to lead or have people follow questions. All right, Kay, I'm gonna take it over to you. Hello, Kay.
Sounds great. Thanks, Parnia.
Welcome.
Can you hear me okay? Great, perfect.
Yes, I can hear you, Kay. Kay is a freelance writer, event planner, social media expert, and community organizer.
Yes. All right. Thanks, friends. It's really exciting to be here with you all. I'm going to go through and I'm going to read the questions and then direct them to the panelists to answer. If you have more questions, please make sure you put them in the Q&A box rather than the chat box, and we'll get to them as long as we have time. This first one's going to be for Aila. Can coronavirus be spread sexually? If I use protection, will I be okay?
Sorry, I had to unmute. So here's the problem with that. We don't have enough data to know for sure if it is sexually transmitted. So far, we're not seeing that link. But the issue with having sex is that generally you're going to be within 6 feet of somebody. You're going to be really close. You're going to be face to face. You're going to be breathing on them. You're going to be speaking to them. Maybe you're going to be gasping. And while you're gasping, there's a whole bunch of respiratory droplets that are going to be expelled really, really close to your face.
Great. Thanks, Aila. All right, I have one for Dr. Sheff. You discussed meta-more relationships earlier. Can you tell us what you would suggest in a situation where meta-more relationships are not good, or you're in a parallel poly situation, or suggestions in terms of just doing your best to get support from elsewhere?
I think that is a challenge when you don't have positive relationships with other parents. That can be incredibly difficult. Maybe if you have a metamor that has a good relationship with their partner, try to tap other people in your social circle to help with the communication. Because right now, like your personal issue with your ex-partner, I feel for you. I have a hard time communicating with my kid's dad too. If I had to negotiate this with him, it would suck. I absolutely hear where you're coming from. Tapping other people in your social network to help support the communication, or perhaps communicating in a way that decreases the potential to misunderstand, but also the anger level, kind of tones things down. Maybe email, text, maybe not so much. I think it's so easy to misunderstand text. If you can afford it, I would absolutely contact either a mediator or a lawyer. But start with your social circle. Like, do you have a good relationship with anyone in your ex's family? Does your ex have a good relationship with anyone in your family? Maybe you could spread the communication out to the family. It's not great. Direct communication is best, but when it's so rancorous and you can't establish a middle ground, then maybe getting some outside help, I guess, is what I'm saying.
Great, thank you, Dr. Sheff. I think Libby would also like to add to this, to the answer for this question.
So was the question, I thought the question was about if you don't have a good relationship with your metamor, like
Yeah.
how to handle that. Yeah.
Oh, I'm sorry.
No, I think that, yeah. Yeah. Well, and I would say that, I mean, I think some of the things that you said, Dr. Sheff, really apply actually to both. But I would just say that if you don't have a good relationship with your metamor, this might actually not be the time to try to have one, because that might be an incredibly stressful add-on to an already stressful time. And so, I mean, yeah. So, I mean, what I tend to do, because I, you know, I've had that experience of not having a very good relationship with your metamor, and done a lot of work around it. And I would say the thing to do is to, I mean, at this time especially, like really spend a little time second guessing some of maybe reactions you might have, or spend a little time like noticing, like if you're triggered by something that happens, but you know, if you don't have a direct interaction with your metamor, like if you're triggered by something that happens, maybe spend a little time with your reactions before like regurgitating them on your shared partner, or, you know, having a big explosive feeling about it, because there's two things going on, right? The first thing going on is, as I said before, we're all kind of like at a heightened level of stress, just baseline right now. And so we are more prone to having bigger reactions to things than we might normally be. So that would be the first thing. And then the second thing is that our metamor might also, as I think Zach might have said, that we're not in the place where we're all going to be our best selves all the time right now. So if you're able to, try to be gracious with someone who might be reacting poorly, might have you know, might be making a decision that you wouldn't make, or might be doing something that like actually literally might be hurtful to you. Spend a minute with it, and, you know, try to be as kind as you can. And then the third thing is be really grounded in your boundaries right now too, right? So if somebody's making unsafe choices like around, you know, some of the things that our wonderful epidemiologist Aila has been saying about how you should be engaging in this pandemic, and the risks that are probably not good ones to take. If someone in your network and your metamor are making those decisions and they're impacting you, like make sure you're clear on your boundaries, and make sure you're clear on what you will and won't allow yourself to be part of. And be clear about those, and communicate those, and communicate them. You don't have to do it in a nasty way. You don't have to like, you know, like shame anybody around what they're doing. You can just say, hey, I'm not for that. That's not for me. That's not something that I want to expose myself to, or my family to, or whatever it might be. So those are my best tips around that.
Great, thank you, Libby. All right, so the biggest question that seems to be on people's minds, we're getting a lot of questions about it, is about this concept of isolation pods, or closed units formed between more than one household. And so there's a lot of questions that I'm seeing about, you know, so what makes that problematic versus one household? How does it differ? And what the issue with doing that might be. So we're gonna start with Aila to answer that, and then I think we have a few other people who would like to speak on it as well.
Okay, so the reason that from a public health perspective, we're limiting things to households when we talk about containment, is that we tried the limiting between several households, and really bluntly, it didn't work. When you move from your home to your partner's home, even within a closed unit, you're still touching fomites and risking transmitting and contracting COVID via contact with pretty much everything we touch. I think for a lot of folks, we don't actually realize how many things we touch and how many times we touch our face or touch things that touch our face. So for example, like moving between closed units is still extremely risky given how contagious this is. And as some folks have talked about, if you have to go on a date, stay 6 feet apart. I can't disagree with this more. From a public health perspective, there's absolutely no reason whatsoever that going on a date is an acceptable risk. You put yourself, your family, your partners, and strangers at risk. And this isn't just a cold. One date could potentially kill dozens of people. And to be clear, this is an opinion, this is measurable, and the impact is quantifiable. So when you're combining households, and you're talking about isolation pods, you're still increasing the risk for yourself and your partners because of that distance that you have to travel from point A to point B. You should only limit excursions from your house to absolutely essential. You know, like you have to go deliver something to somebody who can't go to the grocery store themselves, or you have to go to a doctor's appointment, or you're completely out of food. There's nothing in your house to eat and you have to go to a grocery store. That's it. If you're not going to the doctor, if you're not going out for an emergency run, don't go outside. Don't interact with people. Use Zoom, use Skype, use FaceTime, use whatever you need to use, but don't interact with people in person.
Great, thanks, Aila. Who did we have on board for that? Great, Dirty Lola.
Okay, so yeah, to add to that, just saying that a closed pod is a flawed concept. Nothing is closed about this. If you leave your house, it is not closed. So unless no one is ever leaving, you're not buying kitty litter, you're not buying groceries, you're not checking your mail, you're not a closed system. It's not a circle, it's open-ended. At some point you are breaking and you're going out. I know people who are going out as families, and you may be outside on your own. You may not even come around another person, but if you had to get in the elevator, if you had to walk anywhere on the street, and maybe somebody's way down the street from you, that person at some point passed you. We keep talking about like droplets and not knowing how long things are in the air. So really, no one can say, I'm in a closed system. That is, you're just making excuses. And I'm going to be an asshole right now and say, you're using language and you're not, that doesn't mean anything, because nothing is closed. The moment you leave your house as a unit, you are no longer a closed system, unless you live next door to each other in an apartment building where you don't have to get in an elevator and you're walking from one place to another, and maybe you make a tunnel out of plastic. That would be the only way it would be closed, and no one could ever leave the house. You're leaving the house for supplies, you're leaving the house for fresh air. It is not a closed system. You're putting yourself at risk. I also just want to speak to the fact that we're gross. The fact that we had to go around and tell people to wash their hands. You're not washing your hands. And I go this, like, maybe I wasn't doing 20 seconds. I try to do as long, but I've been really diligent. People aren't diligent. It's not just about washing your hands. What are you doing with your clothing when you come home? When I come home, when I go out, which is rare, I have a box, and my COVID clothes do not walk through my house. Whatever droplets are on your clothing gets tracked through your home, the bottoms of your shoes. My shoes come off, my clothes come off, they go in a box. I take a shower and I Lysol my whole path from the door to the bathroom. Anything you touch with gloves, you're still contaminating. Like, gloves protect you, but it's not protecting everybody else from the damage you're causing by touching things and then touching other stuff. I have a UV cleaner that I use for sex toys that I now use for my keys, if I use my credit card when I was out, for my phone. And even that, I know I could be sick. It is infuriating, and I am so angry about this, that people are going on dates, that people are meeting each other like, I'm gonna stand 6 feet. Are you really 6 feet apart? Or are you, because 6 feet apart is across the street in New York, and sometimes not even. So you have to yell, which means droplets, which means you're putting people, passerbys, in danger. It's just really imperative that we sit down and really look at what we're doing, because we're not as clean as we think we are. People aren't doing all the things they need to do. I really don't know how many people are actually wiping down every single thing that comes in the house or letting it sit. I have cider sitting by my front door in the COVID spot because I didn't feel like cleaning it, and it's going to stay there until, what's today? Today is Sunday. It's going to be there till Wednesday because I'm trying to give time for things to go. Like, even with that protocol, I would not feel safe inviting anyone to my home. And I have been meticulous about cleaning, and I still wouldn't do it. And so I know y'all aren't as clean as you think you are. I know you want to think that you are as clean as the Black mama I grew up with, but you're not. And that's okay. But you need to realize that that impacts everybody. And if you're we've been wearing coats here, your coat is covered. Did you wash your coat, or did you take it out the closet and put it back on when you went on a walk? So if you got droplets on the coat, there you go. So all of that, and then you're taking that coat that could have droplets on it to someone else's house, and you're gonna lay it on there. We live in New York, we don't have coat closets, y'all. I mean, I do, but I know a lot of people don't. And if you do, you're shoving it in with clothes. Now we know pets cannot possibly get sick. I have a cat who likes to sit in my scarves, and now we've made a point to not let him sit in the closet where possibly something could have been. Like, this is serious, and people in our community aren't taking it seriously because, I don't know, we think we're better than, or we just really miss our people. I get that, but we need to be doing better, and we need to really step back and look at every bit of our actions, not just what happens in our home, but the path that you take. My closing thing is, like, you can assess your own risk, and that's fine. You are allowed to make risk for yourselves, but you have to understand that your actions impact other people. So you can assess your own risk, and that's great, but the risk you are taking, they don't just impact you, they impact me. So the more you fuck around, the longer I have to stay in this house and the angrier I'm gonna get. Thank you.
Aila, did you have something to interject with? Sorry, I saw you like.
Yeah, I actually wanted to talk a little bit more about the whole 6 feet. 6 feet is a reasonable distance if there's no wind and there's no circulating air and you're talking at a normal rate. But if you're yelling, that 6 feet extends. So there's so many variables involved. So even yelling across the street from each other in New York, you're still not maintaining social distance enough. The few times that I've had to speak to somebody, I live in Michigan, our streets are a little bit wider, we've got a little bit more space. I'll call them on my phone from the other side of my door. There's no reason that you should be even screaming across the street at each other.
I think Libby also wanted to add something about that.
Yeah, I want to have a moment of like empathy for folks around this, because I know these are hard things to hear. And I know that it is like, I know that it can feel like very like, I don't know, maybe like feels like the walls are closing in. I don't know how it might feel, but I just want to add one more thing in sort of a positive frame, which is that when you're upholding the social distancing, when you're upholding what it is that we're trying to do as a culture, as a society here, you're supporting it from a communal level. Like, a lot of people have said this before, as like, this is a thing that we're all doing for the good of all, rather than for the good of an individual. And that can be a challenging frame especially if you're an American and like you grew up in a very like American, like an individualist culture. Like, I know what's good for me, I know what's safe for me. And it can be very hard to sort of go for like the lowest common denominator for what is best for everybody. But if you think about it as when you're making this individual choice that you might feel like it's safe for you to do this thing, understand that it's not just about like the safety of everybody else, but also the participation. Like, we're all doing this together, as opposed to, we're all suffering together. We could put it a different way and say we're all participating in this communal stamping out of this virus together. Like, it's a thing that we're all co-creating. And I think if you think about it that way, as opposed to, like punishing yourself, sacrificing yourself, whatever that might be, and instead think about it as like, I am participating in a social contract right now. And if I break that social contract, even if I feel like it's safe for me to do, you're still breaking something that if everybody decided to break it, well, then it would be meaningless. It's like having crosswalks, which I know New Yorkers, they think crosswalks are sort of optional, but but like when you follow things that are like publicly outlined and everybody follows them, then they have meaning. And if everybody thinks they're the exception to the rule, then the rule has no meaning. And so I guess just like think about it that way too, as like from a sociological standpoint, in addition to an epidemiological standpoint. Because for me, I don't know, the science is hard for me to wrap my head around, but we're all in this together and we're cooperating to make something big happen that's really hard. Feels better to me. So I just wanted to offer that.
Great, thank you, Libby. There's a couple of clarifying questions coming in about this topic, so probably mostly directed towards Aila, but also if anyone else has anything, feel free. One of the questions is, what about running outside? And another one is about, so this idea of there's no such thing as a closed system, how do we ever get to the point where we can say we've been isolated long enough, this person said 10 days, I believe it's 14 days, to be safe and know that we don't have the virus?
I guess for running, it really depends on where you're running. You're still going to pass people. You're still taking a risk. Don't talk to anybody. Don't engage with anybody. Just go for your run. Try to find, some in the middle of the woods, out of the way place, which I mean is a lot riskier for people, who are not men. But try to find somewhere, like carry pepper spray if you need to. Do what you got to do, but go somewhere away from people if you're running, and then go straight inside. When you're running, you're actually going to be breathing a lot more deeply. You're going to be maybe panting and gasping, and you're also more likely to get, to contract something. Just any respiratory droplets that you do manage to inhale are more likely to take root if you're running than if you're walking. But if you need to run, go run. Just do it as safely as you can. Can you remind me the second part of the question?
About how, if we're talking about how there's really no closed systems, how do we where does the idea that like after 14 days in quarantine we're safe then come in, or how do we navigate that, or to talk about being safe or knowing that we don't have the virus?
So here's the hard part. The 14 days is about average. It's usually between 2 to 14 days, but we've actually recently discovered that the virus has persisted for up to 37 days in some people. It really, this is why, the whole like, well, I isolated for 2 weeks thing doesn't apply. Like, I mean, it's good, but it doesn't necessarily apply, because it doesn't matter if you've isolated. Like, it doesn't matter how long you've isolated, you're still at risk. The only way to really, like, when it does come time to lift these restrictions, we're gonna look at the number of new infections, we're gonna look at the mortality, we're gonna look at available treatments, and then slowly, ideally, then we're going to slowly start lifting those restrictions. We're going to say stuff like, okay, well, you can now go visit your family, or we can allow small gatherings of up to 5 people. And then we're going to keep looking at the data and see what kind of spikes it causes, what those spikes look like. Are there certain demographics? Like, epidemiology is really a lot about looking at the different data, making decisions based on those data and based on probable outcomes. We can't make those decisions when we don't have sufficient data, so we can't really relax things until we have more information, until we actually see the curve not just like flatten, but like just completely go dead. Like, there needs to be, not just a reduction, but a complete erasure, and the erasure has to be measured specifically. I'm kind of babbling, but ultimately what it comes down to is and I lost my train of thought, I'm so sorry. What it really comes down to is that we should not look at the possibility of releasing restrictions now. We shouldn't look at the possibility of, well, I isolated, so then I'm personally okay, or I'm low risk. We should not be doing that risk assessment for ourselves. Because when you're dealing with an epidemic, you're dealing on a macro level as opposed to a micro level. So our behaviors need to align with the macro, otherwise they're not going to be as effective.
Great, thanks, Aila. Dirty Lola, your turn.
I wanted to add, and I feel like people are having a hard time understanding, like they feel like the quarantine is the medicine. Quarantining doesn't cure you of anything. It's not making you immune. It's time to see if you're sick, and then whether you could but it starts all over again. So if you've not come into contact with anybody, if you've been lucky enough, I actually had to quarantine because my coworker was still working. My roommate was still working, and someone in the building he worked in on the floor he worked on was sick. So they called us and we shut it down. We couldn't check mail, we couldn't wash laundry, we did not leave our apartment. After that time frame, it was like, okay, no symptoms. All right, that didn't mean let me go hug people. It meant for now I was fine, but I still operate that under the assumption that anytime I go to the grocery store, mask, gloves or not, coming home and decontaminating, I could be bringing it home. And that's the thing, is everybody thinks the quarantining is medicine. No, it's not that you wait 2 weeks and then you go do something. It's that staying away from each other as long as possible. And if you have to go out, you go out. The 2 weeks is if you know you've come into contact and you're trying to wait, because then you may have to quarantine from roommates and family members. But it's not medicine. You're not going to be immune. It's a false timeline. People keep holding on to the 2 weeks. It doesn't mean you can't go outside and get sick. It's like an STD test. Your STD test is only as good until you fuck again. So the moment you fuck, whatever those results on your STD test, they go out the window. Once you've had contact with someone, unless it's someone that you are fluid bonded with and you know for sure they've not had sex with anybody else and done anything else, you don't know. So all of these points of I'm healthy go out the window the moment we step outside. And I know that's terrifying. And I know, and I don't want people to be afraid, but I need you to really understand that this isn't a game, and it's not a place for us to go, I'm okay because I stayed in the house for 2 weeks, so this means I can go to 15 stores and see a friend and go for a run in a park, because now it's not just about you having it and spreading it, it's you contracting it and unknowingly spreading it, because you can be asymptomatic or you can just have it and not be sick and be spreading it everywhere. And by the time you get sick, it could be too late. So these are all the things you have to think about. We need to move away from that 2 weeks. That 2 weeks is the thing that's fucking everybody up.
Great, thank you, Lola. This one is particularly directed to intimacy, and it's about sort of being in a poly situation, as well as having disability come into play and having caregiving that has historically been split between households, as well as equipment and people with different caregiving abilities. And I guess sort of just speaking to the difficulty around that, or there wasn't really a question with it, but it seemed really important to address and I wanted to pass it along.
Thank you, Kay, and thank you to the person who sent the question. Honestly, I don't feel like I have the knowledge to give an answer for that question safely, so I'm only going to speak to what I've done based on what my doctors recommended, what my personal nurse has recommended, and what I've done because I am mildly OCD. And so before this shit, I was already a fucking germaphobe and proud of it. So a lot of the things that other people are complaining about implementing was just everyday shit in my life for my own mental sanity. So regarding people coming over, I've had a lot of people in my life who are either partners, friends, or family members reach out, like text messages, emails, Facebook Messenger. Hey, is there anything you need? Hey, can I bring you groceries? Can I go to the pharmacy for you? Like all of those things. And that's wonderful. And I know that I'm privileged because so many people do care about me and know about my medical challenges. But at the same time, my answer to all of them was no one should come here, because I don't want them going out in the world and getting sick because they're trying to provide care for me. Now that's what's best for me, because I am sickly, but also healthy enough to fend for myself. I do have some minimal, and I mean minimal, income. Like I'm right there at the line of if any more of my income is impacted and taken away, which a majority of it has already been taken away because of this, I may be homeless. I'm not homeless, but if one more paycheck gets fucked off because of this, I will have to go live with my parents. And I'm blessed to have a place to go, and other people aren't. So I've told people not to come. If they want to help, send me $7 to pay for a grocery delivery. And I'm having my groceries left on the porch. You know, like, do what's best for you and avoid going outside at all costs, and try to think about sacrificing care that you're used to receiving from people and having them stay at home and figure out other ways that they can virtually help you and not have to physically leave their house because you're sick. And I know that that can't be avoided for other people who are far sicker than I am.
Great, thank you, Intimacy. We have a question about hierarchy. Can the panelists talk about hierarchy? Even if you're an anarchist, you do have to make choices about which partners are allowed in your house and which aren't, which sets up a hierarchy implicitly, and how to deal with the feels surrounding that. And I believe Jenna wanted to answer this initially.
So, I kind of wanted to start answering this question by emphasizing that this isn't really a question that has anything to do with anarchism as a political ideology. The type of hierarchy that is being referred to here is not an imposed systemic hierarchy. It is not one that has been forced upon anybody. It's one based upon a hierarchy of need. Anarchism is a collective political ideology, not an individualist one. So what does a hierarchy of needs mean? So a lot of people might feel I need to prioritize the partner with whom I share parenting responsibilities, or I need to prioritize the partner whom is disabled and needs my help in various ways, or the partner who is at a higher risk of homelessness or incarceration, or of experiencing a lot of negative mental health impacts to quarantine. There are a lot of different reasons, completely valid reasons, that someone would choose to prioritize the person who's in the most need right now. And that's not in conflict with anarchism. That's not in conflict with trying to avoid unnecessary hierarchies. Anarchism is concerned with imposed hierarchies that reinforce systems wherein there is a dominant class and an underclass. And determining that I need to shelter in place with the co-parent of my children or my partner who needs extra support is in no way counter to that whatsoever. And there are quite a lot of people who identify as anarchists that don't understand this. I'm being very nice right now. Anarchy does not mean I can do whatever I want. Anarchy does not mean that I have no responsibility to anyone but myself. Anarchy does not give us the excuse to use words like agency and autonomy in empty ways that have catastrophic consequences for other people. Anarchism calls us to collective care and to collective consideration. And it calls us to be adaptable in ways that, you know, you can move in flux. Maybe this week this partner needs more from me. Maybe next week this partner needs more from me. Now in a pandemic, you know, we can't change up week by week, but when people are choosing who am I going to shelter with, it's not hierarchy to decide I need to shelter where my kids are, or I need to shelter with the partner who is at risk of homelessness. That is not hierarchy in any sense that anyone claiming anarchism as a political ideology or ethic should be at odds with in any capacity, or use as an excuse for what is frankly irresponsible, reckless selfishness.
Great, thank you, Jenna. I think Rachel also wanted to add to something about this.
Yes, absolutely. And those are excellent points, Jenna. You know, in terms of practicalities, I had some input on this. Currently, I am sheltering in place with both of my partners. I am in a non-hierarchical relationship. We have been sheltering in place in a one-bedroom apartment for a long time now. However, one of those partners, he was long distance in Los Angeles for many years of our relationship. And that taught me a lot about how I could prioritize my time and that relationship with him, even though we couldn't be physically together in the same space. I think, you know, if you really are committed to sort of maintaining that you are not going to have this hierarchy in your relationship, even though you can't be physically together with that person, you're going to have to set that time aside out of your day to incorporate them in your day-to-day life, your thoughts, agree on a system of communication and integration of, you know, where you're at, set up those regular check-ins, make them feel heard if they are feeling remote and they are feeling like they can't really connect with you. There are always ways to connect. And it's just a call to be more mindful about your verbal communication and the communication systems that you've set up to stay in touch. So it's really going, if you can't see them physically, yes, it can really, really cause a strain. But piggybacking off that point of nesting down with the person who you either practically live with, let's say if a partner's across the country, or who is most in need at that time, there are still ways that you can reinforce the importance of this other person in your life that doesn't make them feel less than.
Great, thanks, Rachel. This question is going to be for Dr. Aila, and then obviously if other people would like to answer, they're welcome to. It says, assuming that COVID-19 remains a threat for at least 18 months, is household isolation the only recommended or acceptable behavior this panel advises for that entire period? While that makes sense now, what metrics might alter that in the future pre-vaccine?
Okay, so again, I don't speak for everybody here. I can speak from an epidemiological perspective and a public health perspective. Infectious disease epidemiology and containment during an outbreak, it's essentially about doing our best to predict the most likely outcome, given the variables we do know and understand. In an ongoing outbreak, the data changes constantly and significantly from day to day. That makes it really difficult to predict outcomes accurately. So initially we saw recommendations like 6 feet of distance and so on. Here in Michigan, we ended up initially limiting gatherings, but because of the infectivity and people not actually following containment protocols and a dozen other factors, we couldn't significantly limit the spread. So we ended up needing more restrictive protocols like limiting ourselves to our household. I suspect that if we can't limit the spread and it continues to escalate and spread, we may face more restrictive social containment protocols. If we can slow the spread by practicing good social distancing and limiting ourselves to only absolutely, completely, 100% essential in-person interactions and interacting with only folks within our household, we may be able to slowly lift some restrictions in the future. Like maybe we'll start allowing folks to visit family, like immediate, you might be able to visit your mom, for example. Maybe we'll start opening some, like certain businesses. It really all depends entirely on how well we can reduce the spread and how well we can adhere to social distancing now. The better we are about following the containment protocols, the better we are about staying safe, and the better that we are about containing the pandemic, the more likely we are to see relaxations of those protocols. If we can't, we're more likely to see more restrictive protocols.
Great, thank you, Aila. Unless somebody else wants to discuss that, we'll move on to the next question. We're getting a lot of questions from folks who are also who are solo poly and who are isolating alone. One of them is about maybe some perspectives or thoughts or tips for people who are in the poly community, who are solo poly sans partner, but who are also struggling with mental health issues while they're self-isolating. Do we have somebody who would like to? Great.
So yeah, I'm isolating alone, as I stated before. I mean, I have a roommate, but you know, it's not the same. we don't really talk that much. So it's been a moment of taking time with myself. And I think in the beginning, I was like, I'm gonna be fine and I'm gonna make sure I'm fine. And then that just led me to having, like, this past week was really hard. It was really hard. It was really hard to get out of bed. It's been really hard to I feel overwhelmed and tired. And it's been really hard to just, I didn't want to talk to anybody yesterday. Socializing did not help. Everybody's like, hey, you can do this. And I'm like, I don't want to sit in a chair and talk to you on Zoom. I don't even want to listen to my Marco Polos. That was me for about like a day and a half. And that's going to happen. And I think it's one, being kind to yourself and understanding that we're all going through a deep traumatic experience. You know, if you were here during 9/11, your body may be going through some of the same stuff, panic attacks, being outside, being tired even though you've slept and had a million cups of coffee. You might be experiencing pains and you don't know why. Like all that is trauma in your body. So it's being kind to yourself, trying to make a plan. I do have people I can talk to. I've found any activity, I pulled out all my crafts and I made a list. I'm a list person. So it's like, here are the things that I have at my, that I can access, what makes me happy, what's going to, even if it's little things, even if it's, I'm gonna lay in bed and eat Oreos and watch Pretty in Pink and do a thing. It's kind of just let yourself go through the moment. If you're lucky enough to be working, I actually have some work and I know people are working from home and you're finding it a struggle to do that work. Just be kind to yourself. Yesterday I said fuck it with trying to have a normal schedule and I was up till 4, but I got everything done that I wanted to get done. And when I woke up today, I didn't feel like a complete loser for not getting anything done because I let myself just be on the clock that my body needed to be on. As far as partners, I'm in contact with I have a current like partner and I have a lover and we're in contact and there's Marco Polo and we watch movies together. And even that, like, to be honest, I'm in a point where he's been stressed out and he has a lot of stuff going on with his family and he lives across the country. And I had to say like, I need to pull back because I get you can't be this right now and I need this and it's hurting me and I know it's not your fault, it's nobody's fault, but I need to like do this. So it's also creating boundaries around maybe you're not going to be able to talk to people sometimes, or you have to pull back with how much you're associating with your metamors and your partners because that might start to feel hurtful. We're going on, I don't know, what is this, week 4? Week 5 for some people. It might be longer. In New York, we don't really have I feel like they keep moving the date. I don't even know if they've given us a date. So we don't know. I don't know when I'm going to see him again. Every date we had scheduled got obliterated. So right now I'm holding on to maybe July and I know that's a pipe dream. So my advice to you is to reach out to when you feel you need to reach out to your friends, reach out to people in your life, even if it's not a partner, try to build that little bit of community, even if it's a Facebook chat. I have like a bunch of different Facebook chats and they're all for different things. I have one for being petty. I have one that's full of my squad and people and we talk about all the things. And I have a space where I can like, if I'm having a hard day, I can go in and say like, I'm not all right and nobody's trying to fix anything. It's just kind of like putting it out there that I'm not okay. And so those are some of the things you do. Also, if you have a body pillow, sleep with it. I never slept with my body pillow and I started putting it in bed next to me like a person and I'm sleeping so much better because it feels nice. And honestly, this is where we are. Like what was that? Was it James Franco with the girlfriend pillow? Like I feel like I'm like, this is my husband body pillow and and you do what you need to do to get through it. And just know that you're not alone. I think that's been very helpful too. We're all out here. There's a bunch of us alone. Maybe we need to have a Zoom meeting, all of us alone, but yeah, so take care of yourself.
Great, thanks, Lola. And before there's a couple other people that want to answer this question, but I wanted to add in another more particular question in the same area, which is about how do you manage lack of self-worth when no one will add you to their quarantine pod? This feels like the no safer sex barrier equals relationship priority discussion, but on steroids. For keeping in line with the mental health and solo poly and self-isolation. So I think we have Zach and then Parnia and then Dwayne coming up all on this topic.
Yeah, thanks. So I look at this from a self-care kind of perspective because it's one of the other things that I teach. And again, I'm training, in social work and looking at this as a social worker in general. Again, we're all going through a pretty significant trauma. by all, I mean the entire world is in the midst of a protracted trauma. I've seen people trying to compare this to other things that we've been through, and no one's ever been through this. We've never been through a trauma that literally kept on, we are still being affected. And so we're seeing things coming up as far as forms of PTSD and stuff like that. And right now, people are just reacting to the trauma as it's happening, and everyone's doing it in very different ways. So one of the things that I definitely always would want to bring up during any kind of trauma, but especially now, is that self-care needs to become more important than it ever has before. In fact, when you wake up in the morning, it should be the first thought you have, because literally most of us aren't going to get through a week without doing something for self-care. And I know we sometimes get busy or we're worrying about things, and at this point, I think the self-care has to be proactive. Me personally, I am a continuous consumer of information. I had to turn the fucking news off. I could not watch another damn daily briefing and hear more bad news. Not only the fact that I realized it was doing me absolutely no good mental health wise now, because I'm someone that has mental health issues as well. It was doing me no damn good waking up every morning to find out how many people died in Italy last night. The reality is I have to take care of me, and sometimes that is wake up, hug my dog, do not turn on the damn TV, and do something for me. The other thing that I would recommend, Dr. Brene Brown says this a lot, we store anxiety in our bodies. Fucking move. I started running again, which for someone like me is almost insane. And yeah, we were talking about, in fact, Ali was talking about the safety of running earlier. I'm a night person. I got no problem going out at 2 o'clock in the morning. Now I realize I can do that as a rather large male-bodied person. I mean, I do things for safety, but I have to go run if for no other reason than it gets a certain amount of whatever is pent up out of my body. That being said, I do talk to people that I love. I mean, I'm solo poly, I live alone. I was fortunate right at the beginning of some of this. I was able to spend some time with one of my partners who stayed with me and then left. And so I've been alone now for, about 2-3 weeks. And I mean, I'm talking to my partners. Some of them live together and are able to see each other regularly. Some don't. And it sucks. It hurts every single day to see people that you love able to spend time with one another. And it's me and the dog. I basically have, like I said, not really interacted with another person other than the folks that deliver stuff to my house. And even then I'm kind of being careful. So it's hard. I mean, I have to kind of really ground myself. Earlier, Libby sort of made us all take a deep breath. I do a lot of that, just taking time. And by the way, Lola was talking about, being not okay. I had to learn something actually from my therapist on Zoom last week. It is okay to not be okay. The world is currently fucked. It is okay to say, I don't have the bandwidth. I'm working from home. I still, work from home always anyway. And at the end of work yesterday, Friday, they wanted us to kind of get together with the team and have sort of a Zoom meeting to kind of happy hour and socialize, whatever. I was on there for 10 minutes and I got sick of the dude bros. They were running their mouths, became a fucking frat party. I'm a natural introvert. I noped out so damn quick, it wasn't even ridiculous. And I told my manager, can't do this shit. It's offensive. I don't have the energy. I'll see you on Monday. I did that for my own sanity because it was literally making me angry, sitting there in a Zoom meeting. And the reality is I can turn this power button off and go do something else that is not harming me. So that, and I've also heard from a lot of people who are sleeping more. That's okay. Again, we're all dealing with this in certain ways. Some of us sleep more. I'm a natural insomniac, so sometimes I don't sleep at the right time, but when I do, I try to not feel bad for sleeping for 11 hours on the weekend when I've only been sleeping 3 hours. And someone's had to tell me this, just because you're not sleeping doesn't make you more productive. Those of you that are not used to working from home, but are now, there is no reason to put in more hours at work. Work however much you need to work, stop working and go try and be you. You have the right to a life. Just because you're home and your job happens to be in the same building doesn't mean you have to always be working when you're there. I'm really good at turning that damn work computer off and acting like it doesn't exist until the next shift starts. So I'm just kind of really advocating sort of aggressively being there for you. Be there for other people, talk and do things on Zoom, but it's okay to say, listen, I just can't right now. I don't have the time. I'm an introvert. At a certain point, I can't handle that many more people. And I have partners that I love, people that I really miss chatting with. Text me or something. I'll get back to you later. But when I'm done with this, I'm either going to go take a nap or just not talk to human beings for a couple hours because I have that right. Self-care is that important. And the other thing that I would suggest is reach out to those that you love and make sure they're taking care of their self-care too. I have had again, I'm an introvert, and so some of this at the beginning wasn't as bad for me. It's starting to hurt a little bit more now, because the worst thing can happen to an introvert is to feel lonely, because we don't have the apparatus to correct that very quickly, particularly now. So I started reaching out to the extroverts that I love who are hurting, and occasionally now they're checking on me because they've seen how I'm turning. Anyway, I'm babbling a lot, but all of that is just about us taking care of ourselves individually, and then making sure we're taking care of each other as well. But you have the right to aggressively do so. You know, tell the boss, listen, this is going to be late. That's okay. If they don't get it now, they never will. I'm a graduate student. I've got assignments that are past due. They know they're coming late. That's fine. They're okay with that. Again, the world is going through hell. We have a right to suffer and to deal with it as best we can. Nobody expects us to break because we're trying too damn hard. It's okay to take a nap.
Great, thanks, Zach. Parnia, did you want to add something?
Yeah, I'll add a little bit. As a sufferer, not particularly as like a therapist or anything. So we did say try to direct your energies towards the community to feel more connected to people, and that's cool if you have the access. If you have the access to do it, do it. If you otherwise, if your tools are gone now, the tools that you've had in order to maintain your mental health are now inaccessible due to the pandemic. And now you're suffering because of it. Wait. My best advice is to fucking wait. I'm so sorry. It might be hell and it's gonna happen. But you have to wait until you get to an emotional place where you're able to create and find new tools. So find those new tools when you can do something about it. Luckily, the good thing is that everybody you know is right at your fingertips right now. Ain't nobody like busy like that, unless of course they're busy at home, which is another issue. However, you can access whoever you want to right now, and they know what's up. We all know what's going on all over the world. And there are people who are willing to help, and they will be willing to help you right away. That's a good thing. Now, I want to stress for everybody, we got to get away from this very westernized political idea, that this capitalistic idea that we have to get shit done or like do something and like gain a new skill or like use this time wisely. Fuck that. Fuck that if it's not appropriate to you right now. I see you, Rachel, like, la, 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 I hate that. No, we can get away from that. But another thing that's very stressed in our far west society is that like happiness is good all the time, and all the time happiness is good, when like that's not necessarily true. Like I come from not only an Eastern culture, but also my Chinese medical background. Everything is yin yang. What we call negative feelings will transform into the positive, and that's just how it goes. This is how life goes. We can't hurt ourselves and blame ourselves if we're not happy right now. Like, don't do that to yourself. Be kind to yourself. Like Dirty Lola was saying, be kind to yourself and take the time to just fucking sit there, live through the hell. It will transform, and just wait until something else happens. It could be even external. Something external might happen. You could get a text, boom, mood changed. Now you have the access. Now you have the ability to access like your new tools. Find new tools when you can. No pressure. No pressure. All right. I think that was it.
Great. Thanks, Parnia. Dwayne, did you want to say something about this as well, real quick?
Oh no, I've got Zach and Parnia hit everything that I was going to hit. So just be okay with not being okay. From one mental health sufferer from another, it is okay. Yesterday I had a bad day. I went to sleep at 2 p.m. and I just let myself not be okay in that day. So it's going to happen. You're going to have highs. You're going to have lows. It's okay.
Great, thanks, Dwayne. And then last real quick comment from Libby before we move on, I think, or intimacy, but let's make it really quick because we're running out of time and we have somebody who needs to get off at 3:30 that I want to make sure we get in.
Yeah, I just wanted to say one last thing here, and this is really a message across the board, because I think a lot of people are in a lot of different situations and they're all hard in different ways. And I love the way that Parnia said that if the tools you don't have available to you are not available right now, just wait. I want to offer another thing here, which two things. The first one is that there are all kinds of ways to get support, and I'm talking about even professional support online right now at reduced costs, because a lot of helpers are out there who want to offer help. There's crisis text lines, there's you know, online chat services that can provide from licensed mental health professionals. There are coaches out there that there are a ton of people out there who really want to offer help and give you support. And I just want to say that, like, shifting, you know, focusing on how terrible things are. I mean, I love the way Zach said it so beautifully, like focusing on how terrible things are, that turning your mind away from that towards things that are positive, that's a mental practice. And if you can be not okay, and I think that's okay to sort of be there. And then I think also it's important not to like use it to beat yourself with, you know, because over time that's going to do damage to you, and you don't need to be doing damage to yourself. There's enough out there that's doing damage to you. So then the third thing that is just embrace joy and pleasure where you can. You know, find joy and pleasure where you can, because if you're holding on with white knuckles, waiting for this to be over, we don't know how long that's going to be. And we don't know if it's going to be worse, like once it's over, right? We don't know what's going to happen. We don't know what our leaders are going to do. We don't know if we're going to, and I mean, I don't want to like catastrophize, but like, you just don't know what's coming. So try to be, you know, wherever you can find joy and pleasure, find it, you know, even if it's, you know, a really freaking good piece of chocolate, or it's, you know, dancing alone in your room, or connecting with a friend, whatever it is where you can find pleasure, like really lean into that and say, oh, this is like really good right now, and just try to be present to it. Because I think when we get in negative thought patterns, we can kind of ignore the good things that are available to us. So that's, I just want to offer that, because I think that it's definitely turned things around for me. And also +1 to Zach saying, limit your news consumption.
A quick idea, just to throw it in, if it's not triggering for you, be the kid that you were. It's just like, maybe, you know, real quick, be the kid that you were once. What did you do to pass time? What made you happy? Do that thing, do whatever that is, if it's not triggering for you.
I love that.
Great. Are we okay to move on? Did other people need to speak on this topic?
Chrissy is going to be having a list of resources at the end of this, so I want to make sure I give a few minutes for that. It could be past 12.
Yep, absolutely.
I'm actually just gonna jump in really quick. Is it okay? I know that we have a soft stop at 3:30. Some people will have to leave. That's totally okay. But I want the people that are going to leave, we are going to put together a big list of resources for you. If you want the list of resources, polychrissy@gmail.com. I will write it in the chat room too. But we are going to put together a digital package for you and send it out as soon as it's done. So I just want to make that abundantly clear. All right, thank you.
Great, thank you, Chrissy, and thank you, Parnia. Real quick, because I know one of our guests needs to leave shortly, and there's a question that I think is good for Amy to answer. Somebody said, one of my frustrations doing this has been the lack of talk about the psychological effects of social distancing. Conversation has been very much framed around the necessity of distancing, which is understandable. My question is, has this been a point of interest in professional communities? How are mental health professionals dealing with this unique situation?
Right, yeah, great question. I think right now we're going through different stages of this pandemic. First, like understanding it and figuring out how to minimize our risk exposure, and what's lost is the actual psychological toll of isolation. Something that is, so all mental health care organizations are now providing free resources in the chat, and then I'll work with Chrissy to provide this. I'm a professional psychologist. I'm a part of the American Psychological Association. It's the largest national organization in the US. And they've been developing everything from fact sheets to helpful videos. And most of this content is about isolation. And so, as in the field, we are absolutely worried about increases of depression, increases of suicidal ideology. These are things that we're being very concerned about. And I provided in the chat too some specific resources. And part of the research that many of us are doing now is to figure out how to intervene early with some positive interventions to help kind of mitigate these concerns of being alone. So something that we can all do that ample psychological research has shown to be helpful to help kind of thwart off depression, very deep depression, could be to create a schedule. And I've heard lots of people talking about that, you know, and even if it's just like, I'm going to watch a movie from this to this, to create a routine can be very helpful for many of us. And doing that with our partners and our friends. I will talk to this person every day at 10 and we will do coffee, even if it's for 5 minutes. Things that small can actually have a very profound effect on our psychological well-being. Something else that we can do, whether we're alone with other people, is expressing gratitude. Some of us might be diary writers and we could say just 2 things we're grateful for every day. We could text that to other people. Just the mere act of expressing gratitude and taking space to do that also can have really profound positive psychological impacts in the long term. So those are 2 quick things that I can recommend to everyone, and I'll post more resources. And as Libby mentioned too, many organizations now are offering substantially reduced psychological, therapy sessions, if not free. I would check at your county level. I'm currently in OC, Orange County, and there are free resources that I'm aware of. So even at your county level, you might be able to find these.
Great, thank you, Amy. There was a follow-up question that I think you're also suited to answer, which is about the best way to find specifically polyam competent individual and relationship counselors right now, specifically online for people in a small area where it's already hard to find, for example.
Right, absolutely. This is something that I've worked with many people in the task force. So I have a task force, a part of the American Psychological Association. So right now, if you're seeking free resources, it might be just difficult to even screen that person, based on what content they might have. Feel free to ask people if they're aware of consensual non-monogamy or polyamory and what their viewpoint is, especially if this is someone new. We also worked with Psychology Today. Psychology Today is the largest directory of therapists. So you can go on Psychology Today, you can say, I want to find someone who specializes in bipolar or family issues, what have you. We worked with Psychology Today to add in consensual non-monogamy and kink as searchable terms. So now a therapist can say, I'm affirming of these identities and relationships, and now you can go and see that person. So that's active on Psychology Today for those of you seeking that person. But right now we're under a very critical time period to get help immediately. I would directly ask the person if they have knowledge and if they're affirming of consensual non-monogamy, and if they're not knowledgeable, if they're willing to do that seeking of information on their own time, so you don't have to educate them in that therapeutic setting for the first time meeting them.
Great, thank you, Amy. And it looks like Intimacy, you had something you wanted to add with this?
Okay, sorry. Had to find my mouse to unmute. Yeah, about the free resources, just to piggyback and give some personal perspective really quickly. I've had anxiety since I was 6 years old, but I didn't know what the fuck it was until I was like 21. And then when I was like 25, I was like, okay, I need to seek professional help about this anxiety and get it under control. And right before like everyone, like maybe the last week of February, I was like, you know what? I'm almost out of my anxiety meds. And I feel like the month before, the end of January, my anxiety like came out of what felt like nowhere. I'm not really sure what was the one thing that was the biggest catalyst for it to spike. And so I was like, I need meds. I'm afraid to go to the doctor because of my own personal immune compromising deficiencies. How do I get my fucking meds? Because of my lack of access to health insurance because I'm self-employed, money is a thing. And so I reached out to my community and I started asking other people that know me about who they use for their mental health practices and their mental health prescriptions. So I'm here to say I take meds. If you don't take meds, maybe look into taking meds. If that could be something that might be helpful for you, there's no shame in taking meds. And my meds are keeping me from feeling like I'm losing my mind. So I'm just here to advocate for that. And there are lots of free resources, but you do have to search for them. And I know that if you go to the National Coalition for Sexual Freedom, there are some resources there for mental health practitioners who are kink knowledgeable and friendly, and also non-monogamous knowledgeable and friendly. And some of those providers may also actually live this life.
Great, thank you, Intimacy. So there's a handful of questions that are all kind of surrounding a similar set of topics. So I'm just going to sort of short summarize them, which is about how to handle situations in which your roommates or your partners that you live with or other people that you cohabitate with in various ways either A, are taking this to a different level of seriousness than you are. One of you is doing more actions to do quarantining and self-isolation and the other is not. Or also just having very different sets of anxiety around it. Some people are feeling, you know, one commenter said something about like 9/11 level anxiety every day. And some people are a little bit, you know, more calm about this and feeling pretty okay. So not only how do you navigate that, but how do you have conversations with people who maybe think they're an exception to the rule or aren't really following to the same level that you are, and sort of how does consent come into play around that and those kinds of conversations?
Okay. So I think before you have the conversation, you need to decide what your boundaries are going to be. So if this is a roommate that is, if you're somebody who's taking it very seriously, but your roommate isn't, and they're doing more, and maybe they're escalating, going out, or whatever those, you know, behaviors you find triggering, dangerous, what have you, I think you need to decide what you're going to do. So if you are having to share space and you're like, this is what I'm going to need, I'm going to stay in my room, they're not going to be allowed in this specific space, we're going to need to disinfect the kitchen, we cannot be in the kitchen at the same time, we're going to have to come up with a schedule. Like, you can't control what they're doing, but you can say, hey, your actions have consequences, and if you're going to live in this house with me, we have to participate in a way that I still feel safe. So if you're going to go outside and be with your friends, this might mean that we need to make a kitchen schedule, and I'm going to have to socially distance in our apartment. And in New York, that could be very hard to do. That might mean you are relegated to your rooms, and that being in a common space, you won't be able to do that together. And it's not to give somebody an ultimatum, it's to be very clear about what you need to do to protect yourself. I think right now people are they don't want to get into fights with their roommates, and I understand that, and you don't want to mess up living arrangements after all this is over. But you do need to protect yourself, and you don't have to put yourself in harm's way because someone else is being careless. And if that person is going to be doing this, it's like, hey, so if this is what you're doing, this is what I need going forward in the house in order to keep myself safe. If you are the person that's being reckless and your person is maybe taking it more seriously, you really need to listen to their boundaries, and you really need to listen to their worries and stop invalidating. I cannot say this more than enough. There is no one overreacting. That is not a thing. People are dying and I have a 21-year-old child in my life, he's still a kid to me, taking bodies out of apartments. It's real. People are dying in their homes, and they won't come get you. They leave a body bag, and people that are being hired by funeral homes are going around and scooping folks up. That is the reality. I'm giving this to you real and raw because I just feel like everybody's looking for the loophole. Y'all just want to be the one to figure out the magic hole that lets you do what you want to do, and you just cannot. And so no one is overreacting. And if you feel like you want to do what you want to do, you have to think about how that's affecting other people. And that might affect how you move around your home. And that's something you're going to have to deal with. There's consequences to all of these actions.
All right, I'll come in after. I'm gonna do my best. If you're the person who you feel like might be the person who's not taking this seriously, I'm not here to shame you. I am not here to yell at you. I am not here to, chastise you or any of that. Think about maybe why. Are you avoiding it? Are you avoiding something? And if the bare minimum, the fucking bare minimum that you gotta do, that you really do gotta do, is listen to people's boundaries and just do what they need. Interact with if you're forced to interact with somebody, like you live with them, or they're in a space, right? Just do and visibly show them that you care about them and you care about how they feel in their safety. You may not have that value. You may not practice it for yourself. You may not care if somebody disinfects your doorknob, but do it for them. That's the best thing I could say.
Great. Does anybody else have any suggestions for sort of how to navigate those conversations potentially, or express that concern with and be able to have compassionate conversations and compassionate, understanding of where people are coming from and maybe their anxiety or not and all of that? It looks like both Libby and Intimacy, whoever wants to go first.
Mine's going to be real quick, and then I know Libby has a lot of great information about this, because about 1.5 years ago, she and I met and we ended up having some conversations, and the education and information she has was so helpful and beneficial to my life that I didn't have before that. So I'm excited to hear what Libby has to say. But briefly, having difficult conversations with partners and family members and just friends, sometimes people have a hard time speaking up out loud and saying things to you face to face. So offer them multiple avenues to be able to communicate with you. Welcome them to email you, welcome them to text you. Then take time before you respond to let your emotions be processed, and then give a calm fucking response. Don't just come back with some bullshit, oh, fuck you, and this, that, and the other, because you're upset in the moment, because you can cause damage to your relationship that you never intended, because you didn't take a time to breathe. 2 hours, 3 days, whatever your time is, calm down before you fucking respond to whatever someone says to you that's difficult to say. And if you have something difficult to say to them, type that shit out and email it to yourself first. Then read it the next day before you send it and ask yourself, is this the most compassionate way I can say this? Does this have wording and language that doesn't feel antagonizing? Just be mindful. It's not hard. Being mindful is a practice, and you make an intention to do it. That's all I have to say.
Intimacy, I love what you just said about mindfulness. I think that's so beautiful, and like taming that reactivity and like just being with your reaction for a minute before opening your mouth. That's so huge. And that would have been one of the first things I would have said. So you took the words right out of my mouth. Lola, you already said another thing that I would say, which is be real clear on your boundaries. And the thing is, y'all, I just want to put out there that to amplify what they've both said, you don't have to state your boundaries with harshness. You can be clear about it without using it as without starting a fight about it. You can just be clear and loving and firm. And that's like so important. But here's the other thing that I would do that I think is really important that sometimes people forget about, which is that I would also be willing to set aside whatever I need to say and listen to someone else. Because I think that a lot of times when there's a difficult conversation to be had, there's a conflict. Oftentimes what happens is there are two people talking and nobody's listening. And the thing is, you might have really, really great points and really, really important things that you need to share. But if you're sharing them at the exact moment that someone else is sharing their really important things that they have to say, and you're not pausing to say, oh, what you're saying is this, can you explain that a little more? Can I make sure I really understand it and get really clear on what you're going to say? And oh, wow, I really see where you're coming from. If you're not doing any of that, then that person's not going to shut up and listen to you because they don't feel like they're being heard. I mean, this is kind of 101 level stuff, but I also feel like it's a thing that a lot of us aren't taught. We're taught how to speak really well, but that's only 50% of communication. The other 50% is listening and really understanding where someone's coming from, even somebody you vehemently disagree with. So if somebody is making some kind of like really wackadoodle choice about that is impacting you, you have to listen to them and really ask them, like, why are you doing that? What's the big reason why you're making this decision right now? Why do you think that's safe? Do you have some evidence to back that up? Like, really try to get a deep understanding of where they're coming from. Because the thing is, if you're trying to problem solve and you understand what the problem is that they're trying to solve, you can get on their side of solving the problem by not fighting with them about the solution that they're coming up with. You can instead say, oh my gosh, you have this problem. The way you're solving it, I have some problems with, but I'm on the same side with you on this problem, you know. And that's the thing that we want to point out in general here, is that we're all on the same side. This situation sucks. We're all on the same side in terms of trying to make things better. And so always be working from that perspective. You know, you're not trying to win. You're not trying to make a point. You're not trying to, you know, get your way. You want to solve the problem together in a way that's loving, in a way that works for everybody, the way that makes everybody the safest. And so if it's really us against the problem as opposed to us against each other, that can really just transform the conversation. So, and the more you can understand about where the person's coming from and the problem they're trying to solve, the more capacity you have to really communicate with them in a compassionate way. So, and I mean, if you want to ask me more about this stuff, this is like my jam. This is my passion. All of these folks who know me know this is all I talk about all day long. So feel free to reach out to me, you know, after this is over, because I could talk about this all day. So I'm going to shut up now. But you can find me on social media. You can find me on the internet. And like, I'm always happy to talk about this.
Great, thanks. Let's move on. So there are a handful of questions coming in around sort of, you know, like, when will this end? Is there compromise to be had and stuff around that? We have, you know, one person saying, you know, it's been 35 days since I've seen another human being from more than 10 feet away. Is there any kind of compromise that can happen, or is there going to be in the future? We have, you know, some other people are saying, well, I'm solo poly and I'm not seeing my partners and we've been isolated. What's the pathway back to seeing each other as we come out of this? What is the future of sort of those relationships look like potentially? Should we be considering closing those relationships? And sort of around, you know, whether or not, you know, what's the issue with harm reduction, or what's the idea around harm reduction here? Because we know that, you know, abstinence, when we recommend it, doesn't tend to work. Is there, what's the area around that we should be thinking about, or trying to keep things from happening? So yeah, if anyone has any thoughts on that.
So I have been tracking outbreaks in conflict zones for several years. Part of my job was evaluating, and just before I continue, content warning for these words, we're going to start talking about child death, we're going to start talking about extreme illness, and we're going to talk about mass graves. And if you really honestly cannot handle that, then mute me now, turn off your sound, and I'll give you the all clear when we're ready. Sometimes when you are dealing with infectious diseases, you can't contain them. People get really focused on things like harm reduction. They get really focused on, well, you know, I did what I had to do and I quarantined for so long and then I just chose to go see my family, and is it really that big of a deal? Let me just tell you firsthand, it is absolutely a big deal when you are sitting there looking at an entire family with 5 children and 3 adults that are dying, and knowing that there's absolutely nothing that you can do about it. When the bodies are piling up at overwhelming levels and you can't give these people any sort of dignity in their death, you just pile them up and you bury them. Sometimes you cremate them and you don't really have a choice and nobody really has a say, and then good luck helping, you know, from a logistical perspective, good luck helping whatever surviving family members are left, if there are any, find those bodies later. So when we talk about harm reduction and we go, okay, but you know, it's been so long and I'm really tired and I really missed my family and I really love them and I really, 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 really just want a hug so badly. I get it. I have been separated from my family for months on end. It happens. It sucks. It is awful. It is better than mass graves of people that didn't have to die, but died because you made a choice. So we can talk about harm reduction, we can talk about finding all the loopholes, but ultimately what it comes down to is there are body counts associated with every decision that we make. This is not something light. This is not something that we can go, okay, but my feelings, and let's start worrying about protecting each other's feelings when we're talking about, how difficult it is. It is difficult. It's going to be difficult. It's going to stay difficult for a long time, and we just need to find ways to accept that and deal with the difficult, because the alternative is mass graves. Mass fucking graves that are already happening in New York City. We're talking, we're looking at potentials of, thousands, if not hundreds of thousands of dead children, and we're just supposed to be okay with that because somebody might be a little bit upset. I'm sorry, it sucks. I am truly sorry. I hope you come out of this with, mental health support, with everything that you need to survive. But ultimately, if we're trying to make a decision between you being able to sleep a little bit better at night or you killing a bunch of people, I suggest you stay home. That's all.
Great, thank you, Aila. Does anybody else have anything to add to that? Okay. I think, Dwayne, you wanted to say something about masks, I believe?
Yeah, so I just got a message on Facebook. Somebody asked me about the statement I said, I'm not wearing masks in public, even though the CDC guidelines say that you should. And that is a safety decision that I make for me. And here's the reason. The reason is that I happen to be a Black man living in America. I'm a pretty powerfully built Black man living in America, right? So I also live in Virginia, which is an open carry, stand your ground state. So I live in the South, Confederate flags everywhere around here. I make the decision to not wear a mask in public because for me personally, I happen to be seen as a threat when I am out by people who might not look like me. And that puts me in danger. That puts me in more immediate danger than, and this is in my opinion, than catching COVID and having to fight it off in the hospital. Now the danger level, especially since I'm in a high risk category with being immunosuppressed, might be the same, but at the same time, it's a decision that I make for me, which is why I say the internal privilege, you should check yourself and use internal active allyship, is because just the other day I'm at a gas station cleaning out my car because it looked like I lived in it for a year. And someone walked from all the way across the gas station parking lot, probably about a couple hundred feet, to tell me that I should be wearing a mask while I am out in public. Now we all make our own risk decisions like everyone's been saying, but for me, not wearing a mask in public keeps me from having a good guy with a gun stand his ground. So that's where that is. That's where that comes from.
Something to also keep in mind as far as your community is concerned, so that we can look out for each other. Should you might see somebody who is making the same decision as Dwayne for similar reasons, with the way that structural racism is set up, and the way that Black and brown bodies are treated by the population and particularly law enforcement, we might be put in a position where we're gonna have to defend them. That might mean physical, who knows? I've seen videos of Black men being dragged off of the public transportation in Philly, I think it was, for not wearing a mask. And that poses far more of a risk to them than just to asking them to leave, or they could have been handled a lot differently. And I wonder how differently it would have been handled if that person was not Black. So keep that in mind when walking around in public, if you are ever in public during your essential runs.
Great, thank you.
All right, can I butt in one more? That's the active internal allyship, right? noticing where you are and what types of privileges you have, and making sure you're not projecting your privilege on others, because you might not be aware of their disadvantage or their non-privileged status at the moment. And that includes wearing or not wearing masks.
Great. Aila?
So I just want to say, like, masks are more about protecting yourself. So I think that if we're acknowledging that the dangers presented specifically to the Black community in not wearing a mask, we're talking about them protecting not only themselves, but they're putting themselves at risk and they're putting others at risk by not wearing a mask. And they're doing that because the risk of wearing a mask is a lot greater. So we have to like acknowledge the sacrifices that people are making within, you know, Black communities and immigrant communities, but and especially Indigenous communities, in not wearing a mask and in treating people the way that we do for wearing one.
Great. Moving on, somebody had a question about you know, any advice or recommendations around if you're in NRE currently or starting a new relationship or had been starting a new relationship when this all started. And I'm going to tie that in also to the question that somebody had about, you know, we're using Marco Polo and Facebook Messenger and what really is otherwise out there to remain connected to our loved ones or the people that we're trying to develop relationships with during this, our time of social isolation. We'll start with intimacy.
Hi, so also one of my other jobs that I'm currently taking a hiatus from for safety reasons is that I am a sex surrogate and I provide compassionate companion services. So I've studied NRE greatly, personally and professionally. Personally, I hate when my brain is stuck in NRE, which is our brains are releasing a chemical that you have no control over. You can't stop that chemical from being released. What you can do is study NRE yourself, the science and biology behind it, and practice recommended social distancing for NRE, which is your brain tells you, I gotta see this person every day, all the time. I wanna see this person all the time. But studies show that the more that you see them, the more your brain wants you to see them. So it's like being addicted to drugs. Like, seriously, it's like being addicted to drugs. So the way to control your NRE is to limit your reactions and make it a schedule. Hey, I'm gonna talk to this person once a day at 7 p.m. for 15 minutes and then go on with the rest of your life. You know, or I'm going to talk to this person every other day. Like, it depends on what you both come to an agreement to, but you have to set a schedule and not like just constantly feed your NRE, because it's like it's like overdosing. And that's the best that I can tell you. Like, that's the best way I can put it into human terms for you to kind of understand. Like, yes, your NRE feels insatiable, but you can manage it. You just have to practice it.
Does anybody have, Eli, would you like to add to that?
Yeah. There we go. Am I unmuted? Yes, great. Okay. I would also say, take a page from the kinksters here. The kinky people are fucking amazing at anticipation and using anticipation for an erotic tool. So check out, you know, like online kink. Get your kink on with each other on Zoom. Just explore it and see what, you know, what you can do with anticipation can be really exciting. The second thing I would say is unlimited masturbation. Together, by yourself, whatever, like COVID-19, all hands on deck, unlimited masturbation for everyone. At any time, but especially now. That's it.
I can't tell if anyone, I don't think anyone else is trying to wave at me. Sorry, there's so many screens up right now. Rachel, did you want? Great, go ahead.
Yes. So just one final comment for folks, because I hear a lot of anxiety around COVID, around death rates, transmission rates, and timelines. My partner and I, he's a senior scientist at NYU Langon's Institute for Systems Genetics. We hold AMAs on this regularly. I put a link in the comments. We will be holding another one next Sunday at 3 p.m. Eastern Standard Time, just to call people's attention to it. And we will ask any anxieties and address any of that folks have, because I'm hearing a lot of that here, and I just want to open that up.
Wonderful, great. Do we still have Jennie on the line doing? Doesn't look like it. Okay. Well, I'm going to open this up to the group generally then. I think it's a good question for us to end on real quick in terms of being hopeful and sort of figuring out what we can do for next steps and what we can be doing to help our communities. Regarding community aid, how do you recommend somebody initialize an aid program in their community? You know, some people have access to certain things like vehicles or barter, but it's hard to try to figure out who to reach because it's hard for people to necessarily share, like if they don't have food publicly. So how can, you know, people as community organizers facilitate getting help to the people who need it while preserving their dignity? Aila?
So in my town, I work with a distro team that distributes food and supplies and also tries to help provide rides for healthcare workers. What we did just to maintain anonymity and protect people's privacy, because of, you know, there's a lot of shame in our culture with asking for help. So we actually set up Google Forms. And then what we did is we had people fill out Google Forms if they needed help or if they had help to provide. And then we would link the people up with each other. It works a lot better, you know, like that method works really well when you've got like a small community. I think in our case, we've got about 1,500 people that are actively working within our mutual aid framework. I'm not really sure how it would work on a larger scale. There's different tactics, different methods, and every different method is going to, or every method needs to be tailored to the community that you're working with.
Great. If we don't have any further thoughts on that, I'm going to turn it. Oh, Lola would like to speak on that. Go ahead, Lola.
So like if you're looking, there's like, I know here in New York and I think in other cities, there's the Nextdoor app. And so it lets you know, like, it can be honed down to your zip code. Some buildings are on there. I've seen some people using that to communicate, like, that they need things. Some older people in the building that I'm in have actually asked if they could give somebody money in a shopping list to go out for them when they're going out shopping. So those are ways that you can connect with people. There's also Facebook groups. I know people have like their neighborhood Facebook group or a building Facebook group, or even if it's putting sticky notes on the doors of neighbors that you know are older to say like, hey, I'm making a trip this day. I would gladly go out for you if you want to leave this, and I'll pick it up and then leave it at your door. And here's my number and we can text. Like, even if it's one person, it also keeps somebody from going outside who maybe shouldn't go outside right now. A lot of food service delivery stuff is down. None of my local grocery stores are delivering anymore. Instacart has not had slots for over 2 weeks. Fresh Direct does not have anything coming into Coney Island at all. Nothing, and with no news about if it's going to. So there's going to hit a point where people who haven't been leaving home are going to. So if we can band together and have less people on the street and do shopping for others, that's a big way to help too.
Well, and I'm just going to throw in a quick reminder that when we say household, we also mean that only one person is going out and doing those errands, and that minimizing the amount of people that are going out to grocery stores and stores generally is part of social distancing. And it doesn't mean that you can take the whole family or all your partners that you live with to the grocery store with you every time. So I think that certainly, you know, that is a great way to minimize the risk for people as well as help your fellow community members. I think we're going to turn it back over to Chrissy, who's going to give us some resources before we finally end this. So there you go.
Yes, thank you again to all of the panelists for being here. This was a sorely needed resource, and I have a feeling that over the next 18 months, this will be the first of many. We need to put all of our resources together in order to ensure that our community stays safe and that we're modeling appropriate behavior, given that most of us are working off script. We don't have a script. We're kind of Wild Westing it out here. So again, I am going to hit up all of our panelists, and we're going to put together a digital packet for everybody of all of the resources we've been talking about. You can get that at polychrissy@gmail.com, POLYCHRISSY@gmail.com. That should be together within the next couple of days. If you found this helpful, I'm going to put together the video recording of it whenever it comes through, and we're going to be sharing that along with the transcript. Special thank you to Atrina for doing a kick-ass job. Thank you. And you'll hear from us from the next couple of days. If you want the resource, just drop me an email and I'll add you to a list. Thank you again to everybody. This was excellent. Happy holidays if you celebrate them. Happy Sunday if you do not. Thank you all for being here. You're really appreciated. Thank you, everybody.
Thank you for having me. Thank you for coming, everyone.
Thanks so much, Chrissy, for all your hard work. You completely rock.
Thank
You all rock. You all rock. Thank you very much. Mwah. Ending the meeting. I'll talk to you soon.
Yay, everybody. Yay.
Yay. Bye, everybody.
Bye.